We, the Center for Global Development, we're a group that try and see how we can make the international system that supports global development work more effectively.
How do we finance infrastructure in the poorest parts of the world? How do we increase productivity in agriculture? What kind of policy brings out the best outcomes?
What CGD is about is you can ask those difficult questions that people refuse to ask and actually find solutions.
We're thinking about how climate change will impact migration patterns, how that will in turn have impacts on people's health.
It's challenging to be able to align budget with ambitious programmatic goals, but it can be done.
If you can help to make things a little bit better, that's a good way to spend your time.
Hear, hear. Okay, that's actually my first time seeing that video end to end. I think it's a good encapsulation of what we try to do here at CGD. So welcome everyone. It's so exciting to see you all here talking about a topic that is very kind of near and dear to my heart. I'd say it's my new passion project, which is the global slow-moving crisis of lead poisoning. This is something I think a lot of us are familiar about in our own borders, as of those among us who are American citizens. And we've all watched as this has played out in some dramatic and really tragic and horrifying ways that we'll talk about today. But one thing that I have learned over the last 2 years is that this is not a uniquely American issue. It is a global issue, and the intersections between how this affects us here at home and what's happening all around the world are enormous and fascinating and a little bit horrifying sometimes. So I think this is the first bit of a whole day of kind of learning and exchange, and I think you will all learn a lot and come away with a lot of probably the same passion for this issue that I have, because once you learn about it, it's hard not to have that feeling. So I'm here today for the first panel with several different distinguished guests. But to my left, we have Jordan Dickinson, who is the Deputy Chief of Staff to Representative Dan Kildee. And he is a representative from Michigan who represents Flint, Michigan, and did so during the height of the water crisis. So we're going to hear from him about that experience. I have Dr. Vic Kapil, who is Chief Medical Officer and Associate Director for Science of the Global Health Center of the U.S. Centers for Disease Control and Prevention. And he's going to tell us a bit about what the U.S. is happening, what's happening in the U.S. as a whole. Zooming out from Flint, what do we know about lead as a poison that's affecting children and adults, and what is the U.S. doing about it? Then I'm going to hand over to Abhir Solomon, who's Global Program Lead for the Healthy Environments for Healthy Children program at UNICEF. And UNICEF, as you may know, is an organization that works on behalf of the world's children, on behalf of their health, education, welfare, safety. And he's going to talk about how this is a global children's issue and why UNICEF has decided to put increasing attention and resources into this issue as something fundamental to the overall welfare of the world's children. And finally, we're going to go to Mark Caseman, who's the Director of the Office of International and Tribal Affairs at the Environmental Protection Agency. And he's going to talk about how the U.S. is engaging internationally to help solve some of these problems and make these connections between the international and the domestic. But I think we have all heard of lead, but I do want to get started by giving a few framing remarks. So, hold on. Oh, sorry. Can we get the slides on the back as well? Thank you. Okay. I don't know why the slides are not appearing behind me, but that's okay. So this is lead. It looks like a rock. It looks kind of inoffensive. Things to know about lead is that it's very heavy and it's very useful. And so throughout the throughout the scheme of history, it has been used for many things. It has been used as pipes because it is virtually indestructible, and it is very good material for bringing water around. Sorry about the slides. Hopefully we're working on that. It has been used for weights because it is heavy, for fishing weights, for helping balance things. It has been used as ammunition in guns. It can pierce deer or people. It is used in batteries. It helps. Lead acid batteries are used to run our car. Every time we put our jumper cables, it's into a lead acid battery. It has been used in paint. It turns out that lead-based pigments are very bright and vibrant, and they create very durable paints. And so throughout history, lead has been added to paint to make it brighter and more durable. Likewise for ceramics, the glazes on ceramics have been used from lead. It makes them hard and shiny and beautiful. And for many years, lead was added to motor oil because it helped prevent engine knocking and allowed cars to go faster. The problem, of course, is that lead is also a poison. It's a naturally occurring in our environment, but it is occurring in the Earth's crust. We did not evolve to be able to deal with lead ingestion. And the most famous and well-known effect of lead is the effects on the brain, the effects on cognitive development. Lead, the science is complicated, but in essence, lead interferes with the operation and formation of neural synapses. And this means that if you're exposed to lead when your brain is forming, your cognitive development does not happen as it should. And those effects are lifelong. And if you're exposed later in life, okay, your foundational neural connections are formed, you're not going to have permanent damage, but it can still interfere in an ongoing basis. But honestly, this is just the beginning. Lead is a poison that affects basically every system of the body, the nervous system, the brain, the kidneys, the reproductive system. It can cause sterility and fertility problems, miscarriage. And increasingly, we are seeing that cardiovascular disease is in large part caused by lead. So just a few days ago, and we'll hear more about this later today, the American Heart Association put out a statement sort of formally recognizing lead exposure as a risk factor for cardiovascular disease and a serious contributor to the overall burden. And a lot of us, if you're American, you've probably come to the issue of lead poisoning in part because of Flint, Michigan, the water crisis, and seeing that play out, wondering how it's possible that we could let our children be poisoned, that it could take so long to fix, that how is this possible that in this day and age this could happen and happen to an entire city? And I also came in with that perspective. And I want to give you two pieces of contextual kind of, to put that experience in context. The first is from America, and this shows blood lead levels declining over time. And what it shows is that actually in the 1970s, pretty much everyone was lead poisoned in America. And we have made tremendous progress in a macro sense in getting that number down. It is still too high, and every child who is lead poisoned in America is a preventable tragedy, and it is a good thing and a necessary thing that we are pouring the resources in that we are to bring this number even lower. But if you look internationally, you are seeing something very different. So in every country that is bright red or the sort of lighter tomato red, these are sort of estimates. There's some data quality issues, but the order of magnitude is about right. We would consider the median child in those countries to be lead poisoned by the CDC standard. The average child in these countries is lead poisoned. 1 in 2 children living in low and middle income countries. That is the norm. That is the table stakes of what's happening around the world. And it is not something that has, to this point, gotten the sort of attention it deserves. And we're also going to learn as we go forward how this comes back and affects us again in the United States. So with that, I do want to turn back to where we started with Flint, Michigan, and with Jordan Dickinson, who is the Deputy Chief of Staff to Representative Dan Kildee. So Jordan, for many of us who grew up after the phase out of leaded paint and petrol in the United States, the water crisis in Flint, Michigan was sort of our introduction to lead poisoning, to understanding the issue. And you had a frontline seat to this whole thing as it unfolded, working in the office of the congressman who represents the constituents of Flint, Michigan. Can you tell us a little bit about that experience? What was it like to help represent or support the congressman representing a city in this crisis? How did it affect your constituents?
I only have 10 minutes. Yeah. So Congressman Kildee, if you guys don't know him, he came from local government. So when we talk about this, a lot of people talk about Flint of being an environmental issue, a healthcare issue, but we really look back at this, and this is a democracy issue in some ways. The people of Flint, Michigan, the governor at the time, Rick Snyder, decided to implement an emergency financial manager there. And all they cared about was lowering costs. and how it affected the people, what services the government provided, including providing clean drinking water, was not something that was a priority for them. And so when the people of Flint knew something was off, their water wasn't smelling right, it looked dirty, it just, the costs were increasing, the people didn't really have anyone to petition, right? I mean, basically in our democracy, we're able to petition our government, and they really didn't have anyone to stick up for them. And when they went to the state government, they were told that just relax, everything's fine. When a local mother went to her doctor, they were told, like, it's just a few IQ points. It's no big deal for your child. But you can't imagine ever hearing that from a health professional. And then when they, we talk about this was a failure of government at all levels. When they went to the federal government, they said, the state's got this handled. And so, we are believers in government. We believe that people have the right intentions. And so when people told us the water was fine, we believed them, right? We had no reason to not know that. So that was kind of like our first lesson of like democracy plays a really important role in this, and local government and people being able to petition their government that something's going on is a real key thing about this and something that really needs to be protected. I'd say the second part is I found out about this was happening through a woman. I don't know if you guys know Dr. Mona. She became an integral part of showing that there was lead poisoning happening in children in Flint. But one of her best friends contacted me saying, hey, Jordan, we've got this lead issue going on in Flint. And I said, well, what's lead? And this was in 2016. I'm college educated. I spent a lot of time thinking about this, and I really didn't think about lead at all. And I think that also became a problem as we went through this, where most people couldn't believe that lead in drinking water was an issue. And we spent a lot of time trying to say, like, number one, it is. Number two, here's the data to prove it. We're essentially using kids as our environmental indicators that there is lead in the water, because our lead and copper rules were weaker at the time. And then, also people are like, well, people can't get exposed from lead in their drinking water, only from paint. And that's how actually the government was really set up for a while, because we didn't think that we really had an issue with lead in drinking water until the Flint water crisis. So that's kind of where we came to this. And, the people of Flint, I think the long-term effects of this is like they have a lot of distrust in government, which is unfortunate. This really manifested a lot during COVID. Vaccine rates are extremely low. People don't want the government involved. They're angry. They are angry at any sort of authority figure in that way, and it's really been kind of disappointing. But I think out of this, there's a lot of bright spots too. The people of Flint, super resilient, great community. The community came together to help old people install filters on their faucets, make sure that people got their water delivered, make sure that people got their groceries. And also out of this, we kind of figured out, we took a step back and said, like, okay, Flint was probably a poor economic city before, and they need help to recover. There's no magic bullet to fix lead. And the congressman tasked me, he's like, okay, come up with a plan. Like, what is our ideal thing of what we want to do to help people of Flint? And I talked to experts in every single area. And what we came to find out is just a well-rounded, good education with access to healthcare, access to good schools, nurses in every school, books for kids, parents and time for them to take care of their kids, nutritious food was really the key. And we kind of figured out the thing with lead that we need to do to help all these kids is what every kid needs. And so through some legislation we passed, we have a thing called the Flint Registry, which is a national lead registry, where they're taking some of these interventions and things and helping out people in the community to see how Flint can recover from lead poisoning, but also how can many other communities that we know about, Newark and other places that are also experiencing this, and here's the plan of what we can do to help out the people there. And I think the people of Flint feel like they've been through a lot. They have been, but I think that they're pretty dedicated to their community and they still want to be there. So I think this started in 2016. Here we are in 2023. We fought for 15 months to get $150 million for the people of Flint, just to get money to replace the infrastructure, money to get the registry. And the Republicans fought us so hard on this for so long. But here we are in 2022, we passed a bipartisan infrastructure law. There's $10 billion in there to replace lead pipes. We've got the president saying at the State of the Union that his goal is to remove every single lead pipe in this country. And it's something that I think that we, as bad as it was and what the people of Flint were exposed to, we've kind of turned our head and really acknowledged this is a big issue, and we're putting the money behind it to do it, and people are taking it seriously. So I think there's a lot of good things to say, but we've learned a lot of lessons on the way.
Yeah, I can imagine. Well, we'll talk more about all of this as we go forward, but I want to turn over to Dr. Kapil, who again is Chief Medical Officer and Associate Director for Science at the Global Health Center of the U.S. Centers for Disease Control and Prevention. So from the experience of Flint, can we maybe zoom out a little bit for context? Can you maybe talk to us about what was happening in Flint on a medical level? How does lead impact the human body? And at the national level, what are we doing in the U.S., including through sort of recent measures that Congress has taken to fund this adequately to prevent lead exposure from happening to future children?
Great. Yeah. Thank you very much, Rachel. And Jordan, your comments certainly resonate with me, and I will talk a little bit about our sort of public health response related to Flint, because I do think we have learned a lot from the experience, all of us, despite the fact that lead is actually quite well studied. And we know a lot about lead and its health effects and have learned much over the last few decades. But nevertheless, the Flint experience has been sort of an eye-opener for many people. When you look at the charts that Rachel showed earlier and the remarkable progress we have made in public health on blood lead levels in the United States, one would think that it is an amazing success story, and it is in many ways. Yet we know that young children, particularly children under the age of 6, are at the greatest risk of pretty significant health outcomes, which you touched on. They're developing, they're growing rapidly, their metabolic rates are different, they breathe differently, they have a lot of hand-to-mouth behaviors. So whether it's inhalation exposure, whether it's ingestion exposure, they're always at greater risk than adults. Now, that's not to say that adults aren't at risk, because clearly, both in places like Flint, where water is an issue, or in occupational settings, we do continue still to see adults who have been significantly exposed as well, although their manifestations, of course, are very different, and that has a lot to do with the blood lead levels and the levels of exposure. We know that small amounts of lead, even relatively low-level exposures, can damage child's growing brain, nervous system, both central and peripheral nervous system. And very high-level exposures can lead to pretty severe neurological outcomes, coma, seizures, and so on, even death. He also touched on something that's relatively unique about lead in that it affects a lot of different body systems, not just the neurologic system and cognition and development, but also the risks around, which we're actually beginning to understand more and more now, around cardiovascular disease and hypertension, chronic kidney disease, the reproductive health effects. So there's a lot to unpack in terms of health effects of lead. Many of these effects are irreversible, especially these sort of low-level effects if these exposures persist for a fairly long period of time. And as I think has been mentioned, there's really, we don't think that there's any threshold or sort of quote-unquote safe level of lead in kids, or lead exposure in kids. The other thing I think that Flint taught us very clearly, and those of us who, a number of you in the room are in environmental health, and I think we know this for a lot of environmental health issues, and that is that Flint clearly demonstrated that this is a huge environmental justice issue, and issue of health equity and inequities. We know that the risk of being exposed to lead, and for that matter to other exposures as well, but particularly lead, that there are significant disparities in lead exposure. Communities of color low-income households, and certain geographic locations, as we see in environmental health frequently. And those things are really important because when we think about environmental exposures, we always think about the relationship between the exposure, or the agent, and the host, right? So it's agent, host, environment, kind of a triangle of things, and those things come together to result in terms of the resulting health impact. So we have to always think about that. So the things that Jordan was just talking about, the nurturing environment for kids, the nutritional issues, the education and the access to health care. These are the presence or absence of chronic diseases, screening for other health conditions that are very relevant, for example, anemia, and things like that. Those things cannot be neglected, particularly in this kind of a situation, because all of those things interact together to mediate those adverse outcomes that we're all focused on trying to prevent. So I'd like to say a few words about about CDC's public health programs that are sort of focused on lead. And then I'll wrap up with some remarks on the global issues which you have raised. So CDC does run a childhood lead poisoning prevention program. The vision of the program is to eliminate childhood lead poisoning as a public health problem. The mission is to reduce blood lead levels in kids, to reduce exposures and risk, and to consider all of these socioeconomic, the health equity issues and concerns, the demographic differences between populations as we do that work. So we try to work with constituencies that we support, and it's 60 plus or 62 or so jurisdictions around the United States, to identify high-risk populations, to ensure effective follow-up for children that are identified with elevated blood lead levels, to promote targeted sort of population-based interventions, because the focus in public health, of course, as you all probably understand, it's not individual patient care. We're not a clinical agency as such. Of course, we do identify individuals with high blood lead levels, but also thinking about the population aspects and thinking about how a community is impacted by lead exposures. So we support those lead poisoning prevention activities in 62 prevention programs around the United States. We're very committed to engaging and mobilizing those community resources. It has to be a critical part of any kind of lead poisoning prevention efforts. We did award, as you, I'm sure many of you probably know, an original grant to support the Flint registry, the lead registry, and we have recently awarded a second 5-year grant to Michigan State University to support the registry, which allows those families who are impacted by the water crisis in Flint to be connected, the main focus to be connected to critical services in the community. And there are a number of goals. If you look it up, you can actually look at what the specific goals of the registry are. It's very telling because it addresses a number of the things that we've just been talking about. I'll say a few words about blood lead testing. This is one of the challenges with lead poisoning is that especially at these somewhat lower levels, you can't look at kids and say yes, no, they're affected, they're not affected. You actually have to test them. So testing is a big challenge, and there are requirements. For example, for kids who are enrolled in Medicaid, they have to be tested at particular intervals. Kids that are not enrolled in Medicaid, they don't necessarily have to adhere to those requirements, but nevertheless may require testing. The bottom line is that despite those Medicaid requirements, even Medicaid enrolled kids are not always tested on schedule. That's a big challenge. Non-Medicaid kids who are not enrolled in Medicaid are often need testing and are not tested. And we also are responsible for establishing the blood lead reference value for the United States. That's based on the 97.5th percentile of blood lead distribution in the United States from the NHANES data, which is the National Health and Nutrition Examination Survey. And it used to be 5 micrograms per deciliter. I think many of you probably know that. In 21, that dropped to 3.5. It's not a standard or a legal threshold of any kind. We're not a regulatory agency for the most part, but it's a reference value. And what that means is that 97.5% of kids in the US have blood lead levels below 3.5. So when we see blood lead levels of higher than 3.5 or 3.5 and higher, then we start thinking about and we start getting concerned about why is that, in a particular community? Why are we seeing more kids with blood lead levels in that range? And that's when we start looking for preventable prevention strategies and interventions that are necessary. So that's, there are challenges around blood lead testing. A lot of the initial testing is done at point of care, using capillary blood. And we're getting down to levels now that those tests sometimes have a hard time detecting levels that low. So there is likely a need to develop better tests for point of care use so that kids don't always have to have venous blood drawn for a blood lead level. So these are all different kinds of things related to blood lead testing that we're working on. And then finally, on the global issues, I think, Rachel, you really hit the nail on the head. We primarily at CDC have a domestic mandate, but we recognize fully that lead poisoning is a huge challenge and a huge public health problem globally. The lead exposure and poisoning is not distributed evenly. I think you saw from the map that Rachel was sharing. We see much, much higher prevalence in low and middle income countries, particularly in Asia, Southeast Asia, South Asia, Sub-Saharan Africa, and in parts of Central and South America, compared to high income countries. So that's a huge equity issue. It affects, even in those countries, it affects poor communities. It's a huge environmental justice issue there as well, because it's typically the poor, the people who are involved in the informal sector, the people who are doing kids involved in child labor, battery recycling, and many other sources. And finally, there's also a U.S. connection. So that has to do with all of the different kinds of products that are imported into the United States. And exported from those countries to other countries, many times from low and middle income countries to higher income countries. So things like spices, cosmetics, pottery, toys, and many, many more things, which actually we know well, and from some of the work which folks in this room have done, and we have done at CDC and other agencies, our partner agencies like FDA and Consumer Product Safety Commission and many others have done, that there is significant risk of importing lead into the United States. So it's potentially a risk for others who are not otherwise directly exposed. So I'll stop my remarks there. Thank you very much for your attention, and I look forward to further discussion.
Yeah, thank you. So, the blood testing, well, first of all, during our breaks, you can go and see one of the methods of blood testing. We have a demonstration point of care device on site. It's one of the only device that allows you to actually get a blood lead reading momentarily after a couple of minutes. But it doesn't detect at very low levels, which is a limitation, and it can be expensive. It's about $10 per kind of test kit, which for low and middle income countries, which is fine in America, but for low and middle income countries, probably prohibitive. Turning to outside our borders and a little bit these same issues of it's hard to know what's happening. I want to turn now to Abhijit Solomon. He is again the Global Program Lead, Healthy Environments for Healthy Children at UNICEF. Can you tell us a little bit about UNICEF's view on lead poisoning at the global level? Why and how has UNICEF decided to get involved in this issue? And how does it interact with the sort of outcomes that UNICEF cares about for global children?
Thank you, Rachel. And thank you to CGD and Pure for organizing this event. I think looking domestic and then looking international is really the way to way to look at it. And also thanking my previous panel members. I think they shed really good light on this. I think for UNICEF has been on environmental health. It's not a new space. We've been there and doing decades of work. We've worked primarily in water sanitation and hygiene and vector control, but we've been tuned in a little bit on the lead space. The first time we came about more publicly around it was around 1997. We worked with UNEP to release a report on lead, information for advocacy and action. And then I think that was also the time where children's environmental health got a lot of momentum. I think the United States did a fantastic job establishing a presidential task force on children's environmental health and safety risks, bringing a whole of government approach, something that we keep talking about, and I'll talk more about it a bit later. At the same time, the G7, G8 at the time put out a communique on the importance of children's environmental health, lead being one of the salient issues there. So we were listening to all of that, and at the same time we were thinking, well, how much of this is actually an international issue? And we were in that thinking about, but we're all very focused on the MDGs at the time, infectious diseases, reducing child mortality, and that is still the focus in many countries that we still operate in. Today we have programs in 130 countries where we work on immunization, maternal newborn child health, and a range of things. So coming back to the issue of lead, one of the data sets we look at is the Institute of Health Metrics and Evaluation, IHME, based out of University of Washington, their analysis of the burden of disease. And in 2019, they released the last estimates, and the new ones are just about to come in. And together with our great partner, Pure Earth, who's been in this space, we worked on a report called The Toxic Truth. And the motivation to do that was just the shocking numbers. At the time, we put out the report saying 1 in 3 children are poisoned. That's 800 million children globally. Completely shocking, unexpected, yeah, I would be out of words to talk about just how appalling the numbers were. And if you look at it, mostly it was in low middle income countries. So Rachel's statistic on 1 in 2 in low middle income countries is how it is as we've been looking at it. And one is, of course, all of this is modeling, and you can look at a global data and say it's so bad, but what does it really look at the country level? And one of the most reliable surveys currently available globally is the Georgia Multiple Indicator Cluster Survey, where we integrated blood lead level testing in the household survey. And we found that 41% of the children in Georgia, the country of Georgia, had more than 5 micrograms of blood lead levels per deciliter. So, and in some of the sub-regions, because that's a good thing about a nationally representative household survey, where you can actually see it regionally, and you can see certain regions of Georgia where it was more than 80% of children having blood lead levels of more than 5 micrograms per deciliter. So that is completely shocking, and it was shocking on the ground to the government of Georgia, who compares themselves with also being part of the EU, so to say. And I think there was a lot of momentum around that, because data is key if you want to move these issues forward. And what we saw was a multi-sectoral action plan that the government put together, a lot of regulatory work that happened at the time, with the support of the Italian CDC, the CDC out of United States with its office outside as well in Europe. And also excellent work that happened out of Pure Earth and with the New York City Department of Health. You'll hear more about it later, but I think there has been progress in Georgia. And so that, just to point out the data issue, but then there are many other issues as well. But just going back to this issue of 1 in 3, I mean, UNICEF and our partners, we've been working for decades on issues of, to ensure that children can survive and thrive in low middle income country contexts, that they have at least a better chance at it. And one of the we try to ensure that they get the basic health services, that they reach the developmental milestones, that they complete their basic educations, and they're protected from violence. We want all of that for kids. And here is an issue, lead poisoning, that affected all of it. And it sort of comes back to say, like, how do we, and some of the new data we are seeing, and I think we will talk a little bit more about that later in the conversations today, is that shocking realization that this is something we have to do something about. So then the question comes, well, what do you do about it? And we have had that on the ground privilege and experience over the last 75 years, working in many of the countries, trying to get basic things done when it comes to essential health services, education services, and so on. The challenge when we talk about lead poisoning in low middle income countries is that policymakers don't know what you're even talking about. And those that know think that it's already been dealt with. So that's the number one challenge that we have. We have a big awareness and understanding problem. And you may have heard lead poisoning, you probably may not have understood all the ramifications it has, including economic losses to the country and all of the issues below that. The second big problem with lead poisoning is that you can look at contaminated water, you can look at air pollution, you can look at plastic pollution. When it comes to lead poisoning, it's sort of invisible. When we talk about, when you talk about contaminated spices and what have we, you can't say, looking at something, to say, does it have lead or not? So that's the environment side of the problem. The other is, what happens to a child? And Dr. Kapil nicely talked about the fact that you cannot look at a child at low levels and say this child is poisoned by lead. And therefore, you need to do testing. So that brings me to the third problem that we have when we look at low middle income countries and trying to get things done, is that testing isn't readily available. You can't do human biomonitoring testing. Children don't get tested for lead in low middle income countries, even with countries that have very well-established diagnostics, right? Were able to roll out COVID tests like this, at much more fast. They'll come to your house and take your samples and give you the results in 2 hours in WhatsApp. That's the capacity we have in several of the countries, in low middle income countries, and they don't do lead testing. It's not at scale. It's not something that's prescribed. And that is the fourth problem, that when you speak to the doctors and nurses, they do not prescribe lead tests because they don't know what you're talking about. Right? So there is that huge gap because the focus to date has been on communicable diseases, non-communicable diseases, not on how pollution impacts health, particularly children's health. And so the doctors and nurses have been great at water contamination and water quality, a bit on air pollution, but talking about chemicals, it is something that is brand new. And then if all of those problems were solved, you get on the environment side, you have a big problem because, again, you have a regulatory challenge and then you have an enforcement challenge. So you can get the laws up, but then how do you get the enforcement up? So it's all the capacity challenges that we have in low middle income country context. So we've been taking so what do we do about all of this? And that's been the challenge, like over the last couple of years, how do we even start to go about it, these issues? And so we've been taking some baby steps, is all I can say, on a UNICEF side. We've been trying to increase really national awareness and understanding of the issue. That's the first step. And we have a bit of a breakthrough in terms of ownership in about 5-6 countries. I wouldn't name them here, just to keep the details off. But the other thing we're trying to do is try and replicate the Georgia model. I think the Georgia household survey was an excellent way to really show how bad it is, the scale of it, how widespread it is, how do you break it down by wealth quintiles. And mixed programming is now gearing up to actually do a panel testing around heavy metals across, and we want to combine that with micronutrients and what have you, to test children 1 to 4 years. So that's the game plan that we have, really to elevate the data side. And we definitely we had some initial contact with DHS, but we need to pick up that contact again and see how we can elevate that conversation globally. The third thing we're trying to do is, and the US has got so much to offer because all that we can see the data and all the progress that US has made. I know there are issues, but in terms of the leadership the United States has provided over the last 25 years, trying to convene a presidential task force on children's environmental health, bringing a whole of government approach, it is so key. And you may see, like, okay, you know, from the US, you may have your view of it, but internationally speaking, that's the kind of leadership we need. We got to get to the premier's office in a country and say, how do you get ministries of health together with ministries of environment, housing, and who it takes to actually address this problem squarely. So that's why we are focused on, because also within the larger scheme of environmental things, lead is a very important thing, but there's also air pollution, there's also climate impacts and other things that children are facing in those countries. So how do you bring all of it together, package it nicely, get the institutional support and backing and so on. And the third and the fourth thing we're doing is the capacities of the health sector, really. And one of the things that we've been working with WHO to, of course, roll out the clinical guidance around testing so that we bring health workers up to speed in terms of what this issue is and how to go about it. But the other thing we're doing is we are going to launch a massive open online course for health workers globally, working with, it's a WHO UNICEF online course on children's environmental health. So it's moving out from those face-to-face training days and presentation modes to an e-learning course. It's not a massive thing in today's day and age, but for children's environmental health, it is a big deal because it's been a long time and it's high time we had done that. And finally, we've been working on public awareness. I think the final point I really want to say is about leadership. I think US leadership on this agenda, both trying to address it domestically, trying to take it international, and the support for that, both from advocacy side and from a technical support side. There are so many problems you've solved here that the low middle income countries have a lot to learn in terms of how you actually do these things. You know, so some of the things are like stage 10 here in the United States. The situation we have is stage 0 and stage 1. If this technical support, which we've been talking to EPA, with CDC, if we can broker some of this, that can really, really make a big difference in this. And finally is the issue of leadership, which your advocacy is critically important, domestically, internationally, through the different intergovernmental mechanisms we have to push the agenda of lead poisoning, ending childhood lead poisoning.
Thank you very much. Yeah, I mean, I think you said a lot of it well. To make a couple of plugs, I mean, first of all, the question of lead being invisible, this is a huge problem. And when you look at that map, it looks shocking, and then you dig into some of the data and you say, okay, a lot of it's modeled because we're not actually testing. Now, I think when we do go in and test, we see a lot that validates that it is the correct order of magnitude, even if there's, you know, some estimates country by country. But the invisibility is a problem. So we actually outside at one of the booths have what's called an X-ray fluorescence device, and I encourage you all between the sessions to take a look. It's very cool. It's this like handheld machine, and you aim it at a bunch of stuff, and it tells you what % lead it is. And we have a bunch of samples of things that you might not think contain lead, but turns out they do. And you can use it to tell you exactly how much lead they contain. So it's kind of fun, kind of horrifying, but certainly interesting. And a good example of sort of the kinds of things that are needed, the kind of capacity that's needed to take something that's invisible and bring it into the daylight so we can actually do something about it. So for our final speaker of this session, I want to turn to Mark Caseman, who again is the director of the Office of International and Tribal Affairs at the EPA. So we've done a lot within our borders. We've seen that. It's not mission accomplished, but we've done a lot. But we do see dramatic declines in blood lead levels over time. How can the U.S. and how is the U.S. helping other countries potentially with lower resource levels to achieve similar results? Yeah, so tell us about U.S. engagement and leadership on this issue and the results you're seeing.
Thank you. Thank you, Rachel, and thank you for the center for having EPA here and having me here to represent the agency. And I also want to acknowledge Angela Bandemir, who's here in the front row, who is our senior international lead for our international lead program at EPA. Anything of interest, I say, is due to Angela. Anything that's not, I'll take responsibility for. But first of all, many of my co-panelists and you have raised, and I just would like to emphasize, why are we doing this? Why is it important to do this work? with developing countries. As you said, there is no safe level of lead exposure. It's just that simple. And lead causes irreparable harm to the body's organs and nervous system, especially in kids because they're still developing. Thanks to regulations on sources of lead, such as gasoline and paint, lead levels have decreased in the U.S., as we've mentioned, but blood lead levels and resulting economic impacts in developing countries are much higher. So the World Bank recently conducted some initial estimates to calculate the global economic burden of lead exposure, and they estimated that lead exposures causes 2.5 million deaths per year, with more occurring in developing countries. They also said that lead exposure causes an economic burden of 4.6% of global GDP, but is higher in developing countries. The burden there is 6% of GDP. In addition to impacts in developing countries, international sources of lead can also result in exposure to the U.S. public. Data indicate that some foods and consumer goods imported to the U.S. from developing countries contain high levels of lead and have been documented in some locations to cause lead poisoning. For example, the New York City Department of Health has been tracking for over a decade lead poisoning in their immigrant populations from lead in products from their home countries. A further indicator that international sources affect the U.S. is that the highest number of violations of Consumer Product Safety Commission requirements for imported goods were from lead. So while we do coordination with other U.S. government agencies, I'm really going to concentrate my comments today on EPA's role in addressing international sources of lead. Our role, excuse me, has consisted primarily of sharing lessons learned from U.S. sources' successes in addressing lead poisoning. I'm going to take a drink of water because I'm getting just a little bit, I think it's allergy season for me. Yep, there we go. No, thank you. These lessons learned can inform solutions and can be adapted in developing countries into the future as well. Historically, the U.S. has made substantial progress in reducing lead exposure. We banned lead in paint and gasoline in the 70s. We regulated lead in drinking water in the 80s and in the 90s. Until now, regulated lead in housing, toys, and children's products. There is more to do in the U.S., and we have been sharing what we have learned so far. For example, one effort we were able to help spearhead was a successful phase-out of leaded gasoline globally. EPA was a key player in this since 2002 and worked in partnership with the United Nations, the fuel and auto industry, governments, and NGOs to help countries phase out lead in fuel successfully by 2021. EPA is now building on lessons learned from that work to help countries phase out lead in paint. Many countries did not ban lead paint back when the US and Europe did so in the 70s and 80s, and they need our help now to do so. And I'll get to the details of this in a minute. But to round out what EPA is doing, we are currently learning about other sources in developing countries, including used lead acid battery breakage, spices, traditional health remedies, and cookwares. And moving forward, future EPA efforts may involve other sources such as these that I've just mentioned. Now, I'd like to give you a sense of how the international lead paint work is progressing and how important it is to keep the momentum of this work going. First, I'd like to emphasize that EPA finds it important to establish national level policies to reduce and prevent sources of lead exposure where they can be reduced, even in the absence of concrete data in a country. Lead paint is one of those sources and should be addressed because we had found lead in paint in every country tested, and lead is not needed in paint. Also, it can become a long-term source of low-level and chronic lead exposure in the future. To help countries address lead paint, EPA is working through an international partnership called the Global Alliance to Eliminate Lead Paint, or the Lead Paint Alliance. It's a private-public partnership co-led by the United Nations Environment Program and the World Health Organization. And it's modeled after the partnership that helped phase lead out of gasoline and establish laws to phase gasoline. We were also one of the founders of that partnership. The Lead Paint Alliance focuses on assisting developing countries to establish laws to phase out lead-containing paint. And EPA supports the alliance in various ways. For example, we help to guide the strategic vision, and we help develop a model law, and I see one of the creators of that in the back of the room, for lead paint and guidance on enforcement of lead paint laws. We also provide legal drafting assistance on development of lead paint laws, including by communicating on drafts and providing expert presenters for Alliance webinars. And EPA helps with WHO's awareness raising efforts on behalf of the Alliance. As we said earlier, it's just raising this awareness is so important. This outreach is coordinated with the U.S. annual national event to raise awareness about lead poisoning. The Alliance has made great progress in helping countries phase out lead paint, but we are far from done. As of this March, 93 countries have laws. That's just under 50%. We have a long way to go to get to 100%. But we know that we've had an impact so far, and the Alliance has the real potential to successfully phase out lead in paint in the not-so-distant future. We have seen the Alliance help accelerate the pace of lead paint laws over the years. After the Alliance was founded, the average rate of new lead paint laws being established nearly doubled. Funding for a global project boosted the pace even more. We had a $1.5 million investment by UNEP's Global Environmental Facility Project, which ran from 2019 to 2022, and contributed to enactment of lead paint laws in 21 countries, draft laws in an additional 18 countries, and it assisted 25 small and medium enterprises in reformulating paints. The project also developed many tools such as guidance on paint reformulation and enforcement of lead paint laws. Thanks to this project and the efforts of the Alliance, the tools and expertise now exist to keep this momentum going. We're halfway there, and we can reach global phase-out if we all work together. Beyond lead paint, EPA is also engaging with members of the Group of Seven to discuss how our countries can help reduce lead paint and other sources of lead pollution in developing countries. In 2022, EPA helped negotiate the G7 Ministers' communique, which stated a strong commitment to reduce lead in the environment. G7 ministers committed to identifying areas of action to strengthen the work on reducing lead exposure globally and to strengthen cooperation with existing international initiatives and instruments. The G7 subsequently held a workshop hosted by Germany, which EPA helped to plan with Germany and the European Commission. The workshop looked at global impacts, sources, and solutions. The World Bank presented their initial economic impact estimates that I mentioned earlier, and that had a big impact on elevating the importance of addressing lead in the developing countries. The workshop discussed some known sources such as lead paint, lead acid batteries, and spices and cookware. And the successful ongoing work on lead paint was noted as an important low-hanging fruit as a good model for other sources. Based on the workshop, G7 members identified some broad areas of action they may consider taking to achieve a world free of lead poisoning. To highlight a few of them, proposed actions included strengthening the linkages between environment, health, and development officials. That's always a challenge we're a little bit siloed sometimes. We need to get our agencies together. Assisting countries to develop and implement domestic actions to reduce lead exposure, and raising awareness, assessing exposure, and continuing discussions in the G7. In 2023, the G7 reaffirmed their commitment on lead, and EPA is working with the European Commission and Germany to plan a second experts meeting about how to collaborate on the previously mentioned actions. To summarize my remarks, EPA has been working to help reduce lead sources in developing countries since the early 2000s. We plan to continue engaging through the G7, and we will also raise this issue with the G20 as appropriate. We aim to continue tracking and engaging in other international discussions, and we are beginning to coordinate informally in the U.S. interagency, meeting with both USAID and the State Department and others to explore further work. In fact, we just had a discussion with CDC in the green room before this presentation.
The discussion is happening as we speak.
That's
it's
right.
happening right now.
In real time. In fact, just last week, together with UNICEF, we jointly briefed the lead subcommittee on the President's Task Force on Environmental Health Risks and Safety Risks to Children. And lastly, but not least, we intend to identify further opportunities for EPA's cooperation internationally with G7 and other partners such as the UN Environment Program. Thank you.
Thank you, Mark. Well, yeah, it's very exciting to see the U.S. engaging. I mean, it's both exciting to see all that the U.S. has done, including the Biden administration, on this issue. It's exciting to see that work going internationally as well. I think, one theme that comes up again and again from you, not necessarily believing at first, right, there is a problem, to what we see in low and middle income countries where there's no testing, is this question of awareness and advocacy and bringing something invisible out of the shadows and into the limelight. Can you maybe talk a little bit about the role of advocacy, of local advocacy, of national advocacy, how that sort of brought the issue to your office, and then for Abhit, how you see that kind of in your role interacting with other governments?
Yeah, I think it's multi-layered, but like the real reason that we even figured out about the Flint water crisis, and probably most people don't have this, is a mom who had a sick kid, and she had some construction in front of her house and found out disturbed lead pipes, and that's kind of how we figured it out. And she went to the doctor. I mean, like that was, and she became one of the best advocates, but people just didn't believe her. She's just a mom. She probably didn't know a lot about this. And it wasn't until they were able to connect the data from Medicaid and child's blood lead testing, and Dr. Mona was able to put out a study that was peer-reviewed. I mean, that's hard to do, that it really got the attention of everyone. So, I mean, that's why, my first thing is always talking about, like, democracy and civic engagement. It was just, you had to listen to the people. And, like, they know when something's not right. People live this every day, and they had to find a way to do it. Stemming from there, though, like, even the people of Flint needed a lot of help to do things. Like, the NRDC, without their legal expertise, the people of Flint would not have won a case against the state to have them pay for every single lead service line to be removed. And so civil society organizations, from a legal aspect, were really important. And then also, there's just like so many good stories here of like, there's a guy, like a scientist who came from Virginia Tech, just to, like on his weekends, drove his minivan up to go, and with some students to go test people's water. There was people who came up with a book recipe of ways that you could have more nutritious food. So it really took a lot of the civil society organizations to help out. But to be honest, that was probably not how we would prefer it. The government should be there to ensure that people are having safe drinking water. And it almost felt like, I work in the government, so I'm part of this too, but like it almost felt like there was people in the government who were so hesitant to want to believe people that they were like against the people rather than on the side of the people, and they should be serving the people. And so, some of those people who were against people were held accountable. But that, the government really is the best position to do it, and civil society is helpful, but they don't have the breadth or regulatory ability or enforcement ability to do it. And that's why we do need strong government, I think you said like a whole of government approach to do this. But it really starts with believing the people, and that was kind of the biggest part.
And Abhijit, from the other side, it's less bottom up and more top down. But when you go in and you talk to governments and you present them with some of the data coming out of their countries, do they believe you? What's the response you get? How do you broach this subject and get them to take it seriously?
Sure. I think more broadly on advocacy, it's just as Jordan put it. It's multi-layered. Right? You got to use all the buttons you have, and I think this is one issue where I would, from an advocacy perspective, just use all the buttons that are possible. I think in low middle income countries, and things vary from country to country in terms of how you approach some of these conversations. There is no straight path, and you don't always probably go with data per se, but you start the conversation more broadly around contamination and pollution and how that may be having an impact on children's health. And with that, you see this is what we are seeing in some of the countries, and we share some of the data. But again, it's a process, right? You start with those conversations that leads you to, and then you put the case studies up. The stories are important. Community stories are absolutely critical to make the case. I think the role of civil society is absolutely critical in several of the countries in terms of trying to inspire that action, trying to bring the stories from the field right at the policy table. So a lot of the things we do is actually try to convene around some of these issues as well. At the country level to get a more holistic sort of advocacy around it. And I think every avenue, as I said, we need to press all the buttons. So everything we can do to actually elevate this issue at the intergovernmental level, in the private sector forums, in civil society forums, is absolutely critical. And that's for one of the things that UNICEF is doing as part of this in terms of what it can do is trying to build a global collaborative on healthy environments for healthy children, exactly for this reason, because we need to transition from the wash and vector control days to a much more holistic approach to environmental health, and particularly the risks to young children. And that's what we want to change. It starts with, so sometimes the advocacy of a lone health worker can be absolutely critical at the same time. That's the idea of doing the international course that we're doing, or e-learning for health workers. And you know, the internet has some stories around this issue, but not enough. And it's still, and particularly from developing countries, there's some great films that have been recently produced. Pure Earth has produced an excellent one. There have been a couple of more that have been produced in some other countries, but I think trying to bring this to more attention, like general public attention, can move mountains in terms of advocacy and getting the governments to take the actions that they need to take to address this issue.
Yeah,
Can I add a point? So, first of all, the reaction we generally get when we first go to a developing country on this is, we took lead out of the gasoline, we don't have a lead problem. There is no lead problem. That's the number one reaction I get. The second thing I wanted to, and of course then we tried to convince them otherwise, but a lot of the countries that we work with do not have a culture of public engagement the way that we do. So what we try to do in all of our programs is build that in and try to bring in the stakeholders that aren't always brought in from the government program. So we do have very technically oriented programs, but we try to make sure that's part of everything as well.
Yeah, and I mean, I do think there's an appetite for it. So we've been doing a bit of work in India, and where we're just starting to get this on the radar of the government. And to be fair to the government, they are receptive, and they're interested in what they can do. But they're not the only avenue into India. We've also been meeting with the Pediatrics Association, with the Nurses Association, and these are, I mean, in India, these are membership organizations of 100,000 people. The power of disseminating educational materials, advocacy, information, guidance to their membership is enormous. So, and then that also bubbles up as a demand for the government to do more and to engage more in their part. So it comes from all levels. I completely agree. I guess on a slightly different note, I mean, we had the phase out of leaded petrol globally, which you talked about, which is an enormous public health win. I think it has a claim to being one of the biggest public health victories of all time at the global level. In the US, we've effectively phased out leaded paint. That hasn't happened everywhere. What do you think is the next big win in lead? What's the next thing where it's doable, where it's on the agenda? And this can be both domestically in the US or internationally, or both. What's sort of in your sights as, I think we can get this done?
Well, from EPA's perspective, you're not going to be surprised from my remarks. We think the next big win is on lead paint, because we're halfway there. We now have developed all the tools so we can get there. That doesn't mean that there aren't other issues that we're going to be working on at the same time, but we think we can get that one across the finish line first.
Just like we've been really focused on lead in drinking water, obviously, and I mentioned this about the president's goal to remove every single lead pipe in the United States. I do think that's doable. Like on your previous comments, I think what I would think, I do a lot in trade policy. Like a lot of people are like, well, what is the U.S. bringing to the table? I think a technical expertise on removing lead pipes, it's actually a lot harder than we know. Mostly like we don't know where all the lead pipes are. That's a huge issue still, even in Flint. There's a lot of ways to address it. And so like the U.S., I see a lot in our role of like technically figuring out how to do that efficiently and effectively, because it's really expensive. I mean, like $5,000 to $7,000, maybe even like up to $10,000 to remove a lead pipe. We got to get that cost down, and the U.S. can bring that technical expertise in there. And we could remove every single lead pipe in the United States, but we've got to find a way to get the cost down.
Yeah, well, and I mean, the easiest thing to do is not put them there in the first place, right? And for countries that are still building their water infrastructure, still painting, putting new paint on the wall, that's a legacy cost for generations to come.
And I do agree with both of those points. I do also think that in low-income countries particularly, and to some extent in middle-income countries, I do think the informal sector is another important sector to pay attention to. It's hard to tackle in things like recycling and batteries, and even in industrial operations where you many times you have, in some of these countries, children working, or at least older children working. So I think that informal sector, it's poorly regulated. There's little occupational health regulatory oversight, and some of those situations result in very, very significant exposures. And to your point earlier, Rachel, about engaging the health sector, I think that also is very critical. Nurses, physicians, and we have training materials that we're continuously developing, educational offerings to try to engage. I mentioned the challenges even in the United States with blood lead levels and doing surveillance. So in other countries, it's even more pronounced. And I think if we can work together with those governments and those organizations in those countries, I think we can go a long way to also raising awareness on some of these lead issues.
And I'll just make probably at the risk of repeating myself, but just say that, I mean, our ambition is over the next 4 years to have at least 50, well, I hope we get to 50 low middle income countries prioritize children's environmental health. That's what we are aiming for, and lead poisoning is one of the core issues there. So we're going to use every button to actually raise the profile of this, because it's the mix of climate issues, environmental pollution issues, and the residual poverty-related issues, all of it that needs to be brought to attention.
So we are almost at time. So I have one last question for all of you. There are people in this room who are new to this issue, who are hopefully hearing this and they're sold that this is a thing we need to do both at home and abroad. What's a way that people can engage? Do you have thoughts on, helping advocate, helping get the word out? Do you have any suggestions for people who might want to play a part in this overall national and global fight and in their own communities?
Well, obviously, I'd say talk to your member of Congress. And I guess I'll say this actually more seriously. A lot of people are like, well, I don't know how to call my member. I don't know. Are they even going to take a meeting with me? Members are driven by their constituents. Even members who you would not even expect to join something because it doesn't fit their political issues, they get really engaged based on what's happening locally. And we've seen this like a number of times in different areas. And so try to hit up your congressman for a meeting, kind of know what you're talking about, have an ask in the district or DC. But I think, if you have something that you see in your community or something you're really passionate about, you'd be surprised the power of 3 people who are constituents who can call their member of Congress, because they are very responsive, I think. At least we try to be, but I think it's true for everyone. Very responsive to even just a few constituents. I mean, if you had 20 people who were really fired up about a specific issue, that would jump to the top of the list pretty quickly. So that's my advice.
Yeah, I think that's great advice. I'll stick to the health sector, and I would say for any of you that have kids in that age range, talk to your healthcare providers about lead. If nothing else, maybe you raise a little awareness in their minds. Whether you go to a physician and a nurse practitioner, and also it's a very multi-sectoral issue. So I would even think beyond the health sector. Think about teachers and daycare facilities and things like that. Lead is, in medicine, we call lead the great mimicker, because lead, especially low lead levels, even higher lead levels, they mimic all kinds of other things. Even at very high blood lead levels, kids may have nausea and vomiting and irritability. Well, every kid has that at times. So how do you even begin to think about it? Well, you have to have some index of suspicion that lead may be an issue. So talk to your. I think the more we can talk and raise awareness, not just in the healthcare sector, but also in people who interact with kids a lot, I think it would be very valuable.
Just add to all that's been said, I mean, the multi-sectoral angle is a very important one that Dr. Kapil pointed out. I think engaging health workers and teachers and ECD workers and more generally across the communities is critical. So on that personal level, I would definitely say, yes, press all the buttons. But in your organizations where you are, if you could raise the profile that you represent, raise the profile of lead poisoning and what the contribution could be, how we can push the boundaries a little bit to prioritize this issue. Because, from a UNICEF perspective, this is the big one that we should have moved a long time ago. So.
Yeah, so we get asked all the time, well, why isn't EPA doing X? And I have to say, we can't do anything that Congress does not authorize us to do. So I also agree with Jordan, talk to your congressman there. And on the personal level, I agree. If you have kids, it's not just lead pipes to homes, it's to institutions. And so, I mean, I think we've done a pretty good job on schools, but daycares, et cetera. We did an awareness program in the 90s with the State Department, and we started testing embassies and some residences, and we found out that the U.S. ambassador to Mexico's residence had lead, right. and his child had lead poisoning because of that. And luckily, it was fairly early in this, but still. So this is something you want. If your child is in an older facility or whatever, you may want to talk about that facility and make sure that they've tested. And if they haven't, get them to do it.
All right, thank you, everyone. That's great advice. So we've had quite, I think, an overview all the way up from Flint to the global level. We are going to have about 45 minutes to learn and have some snacks and check out the cool Zappy devices to see if there's lead in things. And then we're going to get a lot more specific about exactly where lead is coming from, and exactly what it's doing, and exactly what we can do about it. So thank you so much.
Thank you.
Our program will begin in just a moment. Please take your seats in the event space. We're about to begin our program in just a few minutes. Please find your way to your seat in the event space. Thank you.
Hello, everybody. Can you hear me? Yes. So welcome back to our second session. I'm Karen Matheson, and this is my second month here at the Center for Global Development, but I've been working on this issue for a long time, and this is the very first panel that I've had the pleasure to moderate, and I'm really quite delighted. So what we're going to do in this session is just get a little bit more granular about some of the sources of pollution and what we're sort of seeing in terms of the impact in a number of different areas. So Drew McCarter, who is from Pure Earth, is going to start with a pretty big overview of sources of pollution as we know them now. Then we're going to hear from Amrita Kundu, Assistant Professor of Operations and Information Management at the McDonough School of Business at Georgetown University. And she's going to talk about the impact of the e-tuk-tuk battery recycling in Bangladesh. So definitely getting pretty specific there. And then Anna Navas-Asien, Professor and Vice Chair of Research, Department of Environmental Health Sciences at Columbia. It's really called the Columbia Mailman School of Public Health, isn't it? Yeah, okay. And she'll talk about the research on the link between lead and cardiovascular disease, which I think we just heard from the last panel has now been identified by the American Heart Association as a risk factor. And then finally, we'll hear from Lee Crawford, who's a research fellow here at CGD. He's going to share his meta-analysis on lead levels and education outcomes. So before I get started, I just wanted to say a couple of things, general remarks. And first is I've known Rich Fuller and his team at Pure Earth for a long time now. And I first met him at the Treasury Department, and that is not a natural sort of place where one would work on lead poisoning. But he was tremendously compelling. He's tremendously compelling. And at that point, he was talking even more broadly about lead and other sources of toxic waste. And one reason it's so compelling is it was pretty clear even then that this has to be, in my mind, the greatest mismatch between impact in the health space and the attention and the funding it gets. And we've been starting to close that gap, but it's taking a long time. The funding is a rounding error. Rich was just telling me it was $10 million, which from foreign assistance, which just blows my mind. I mean, a project that small wouldn't even come before a board at the World Bank. It would just sort of be automatically approved. It's just extraordinary. And we heard from our last panelist, he got Flint, Michigan, $150 million for that one community, and that President Biden's spending $2 billion so far on lead pipes. So when you compare that to the minuscule amount that's being channeled to address lead poisoning, it gives you a sense of the huge scope of the problem. I mean, the good news is we're starting to have events like these, the community's getting broader, but the lag between the knowledge and action, I think, is, again, got to be one of the biggest in this sector, in the kind of health area. So the last panel talked about all the challenges, and so now we're going to start by talking about getting, as I said, a little more specific on where you need to promote awareness, since it's sort of an invisible scourge. We don't automatically know the source or the effect. So that's what we're going to be talking about this afternoon. And Drew, let's begin with you. I think we have a PowerPoint, yeah?
Yeah.
Okay.
So as Karen said, I'm Drew McCarter. I'm Pure Earth's executive director. I share the leadership role with Rich, who founded the organization. We're a nonprofit. Our headquarters is in New York, but we have 8 country offices around the world. And our mission is to prevent people from being exposed to toxic chemicals, specifically in low and middle income countries. And we do this by running, to oversimplify things dramatically, 3 types of programs. We help countries test kids' blood, which is a really rare activity in low and middle income countries and incredibly important for providing visibility into the problem. Then automatically the next question is, okay, we've got a lead poisoning problem, what's causing it? What are the drivers? So we help countries test different environments and products to figure out what the priority sources of exposure are. And then finally, we design source-specific interventions to reduce exposures. And there's research and advocacy and communications and lots of other things. But those are the 3 main buckets. We used to work on all sorts of chemicals, but we realized that lead far and away was the most damaging chemical in the world to human health, with mercury probably being number 2, and so now we just work on those 2. So I've been asked to talk about sources of exposure, and I'm going to do that. But if you leave here and you want to know more about this, Abit from UNICEF mentioned that we collaborated on this 2020 report called The Toxic Truth. And it's the best primer that I am aware of to just dive into this. You don't have to be an expert. You don't have to be a toxicologist. This will give you just a wealth of information about the health impacts from lead, the sources, and what can be done about it. So go seek this out. It's online. The main headline, of course, is that 1 in 3 kids are lead poisoned in the world, and 1 in 2, as we heard from the previous panelists. I'm going to take a little presenter's privilege here. I've been asked to talk about sources, but I just want to talk about, and Karen alluded to this, the insufficiency of our global response. Lead kills, at the minimum, the same amount of people as AIDS and HIV does. UNAIDS suggests that we spend about $20 billion annually in international funding to address AIDS. We spend about $10 million on lead. That is 0.0005 as much money as we spend on AIDS. It's the difference between a 660,000-gallon Olympic swimming pool versus a 3-gallon jug of water. So that's our current response to lead. Okay, now on the topic I'm supposed to talk about, sources of exposure. 2 things you need to know about this going in. First, everyone wants to know, oh, what's the number 1 and number 2 and number 3 source of exposure in terms of contribution to lead poisoning? The answer to that is no human on Earth knows. And it's not even really the right question, because the second fact about exposure sources is that it varies tremendously from place to place. So asking this question at the global scale is kind of irrelevant because we don't really act at the global scale. We act at the national scale, at the provincial scale, at the municipal scale, and the answer to that question is going to change at each of those levels. And I'll give you an example of that a little later. But there are some usual suspects that are kind of common around the world. Ceramics made with lead-based glazes. This is, a lot of people are aware of a challenge in Mexico with this, but it's not limited to Mexico. In Mexico, they fire these ceramics with wood-burning kilns, and that doesn't really fix the lead in there. The lead can come out in the presence of heat and acid when you're preparing and serving food. Recently, a kind of an emerging source, there's been research on it for a long time, but it's gaining more prominence, is lead in cheap aluminum cookware. I think the last panel touched on this. People will take mostly aluminum, but other metals, melt it down to make cheap pots. This is done in small batches in towns around the world. And that lead is bioavailable also, although it needs a lot more research. Another kind of lately emerging issue is spices that are intentionally adulterated with lead-based pigments to make them brighter in color and maybe even heavier because you sell it by weight. So this is a challenge, we believe, in kind of a belt across the world. If you can picture starting in Morocco and kind of go a country or 2 north or south from there and then go straight across until you end up in South Asia, it's kind of popping off in countries across that band. Lead-based paints are one that we're most familiar with in this audience, I suspect, so I don't think I need to go into that. And then another one that I'm going to show you some pictures about is informal and substandard recycling of car batteries, or what the industry would call lead-acid batteries. And so let's just jump right to that. There's also cosmetics and medicines and toys, and if you want to dive into those, go seek out the Toxic Truth Report. But I've had the privilege, to see a lot of informal battery recycling sites. Is this still working? Yeah. And not many people get to see these things, so I thought I'd just show you what it looks like. All right, so this is in Bangladesh, and these boys are probably 13, 14 years old, and they are just manually dismantling a car battery, and they are completely covered in lead dust and sulfuric acid. And this is a really common scene all around the world in low and middle income countries. After they take, a car battery is basically a plastic box with lead plates and sulfuric acid. That's why it's so heavy. It's filled with liquid and heavy lead. They take out the lead plates, that's those black things there. They'll toss them into a barrel or a hole in the ground, and then they'll melt it down. And as you can see that black plume of smoke there, they're losing, I don't know, 10, 20% of the lead just as fume going up, and that's going to land back down in the neighborhood around them. And then what they'll do, this is often a team that just leases a plot of land. They'll do it for 2 years until the neighbors get angry enough. Then they'll cancel their lease and they'll bounce and they'll disappear. And they'll leave a scene like this behind, completely lead contaminated. And then we have to come and clean it up. But it's not limited to informal backyard operations. These 4 photos, I took all 4 of them. These are in India. These are licensed, regulated, inspected facilities. These are formal sector facilities that are no less horrifying than the previous informal ones that I just showed you. So that's what that challenge looks like. Now, what are we doing to try to answer this question about what are the priority sources? What are the main drivers of exposures? Well, our organization does 2 programs that both try to provide answers to this. The first is called, or what we call rapid market screening, which is a cheap, fast, kind of light touch. And then we do something else called in-home source analysis, which is a more in-depth, more expensive and time-consuming. And let me dive into both of those. So rapid market screening, we are funded through GiveWell and Open Philanthropy and a couple of other generous donors to go to 25 countries and go to 3 cities in each of those countries, a couple of markets in each, and buy thousands and thousands of consumer goods from basically 10 categories. So it's spices, it's grains, it's paints and toys and cosmetics and medicines and ceramics and metal cookware, and I'm probably forgetting 1 or 2. And we test all of them for lead with that XRF device that is being played with in the back corner there. And we send a subset to the lab to just confirm our results. And we expect to release the results of this huge program in a formal report probably toward the end of the summer, but no promises exactly. But to give you a preview of what we're finding, about 20% of the products that we've purchased around the world have exceeded the relevant threshold for that product class. And I forget if I have a slide here that goes in depth more. No, I have not, because you should wait for the final report. But this is an image of the countries, and you can see it's a pretty good representation geographically of low and middle income countries around the world. So we hope and think that this will provide like a compass, a good indicator of issues that require further study. This is not going to tell you what the #1 source of exposure is in Ghana, but it's going to point to things that require more in-depth research. Oh, I did include the preliminary findings. So just very briefly, you can see 50% of the ceramic ware that we found exceeded thresholds, 50% of the metal foodware, almost 20% of the cosmetics, 10% of the toys, over 50% of the paints, so just a tremendous amount of contamination in basically every product class. Okay, what's an in-home source analysis? Both blood lead level testing is really rare, and we've teamed up with UNICEF and Vital Strategies to try to, we're involved in 7 countries with those 2 partners, to run big blood lead testing campaigns. By big, I mean a couple thousand children. And then what we do is when we have the results, and we have a pool of lead-poisoned kids, we'll go into the homes of several hundred of those, and some non-lead-poisoned kids as a control, and we'll just start testing everything in their home to try to establish a correlation between lead-poisoned kids and the presence of certain consumer goods or contaminated environmental media. So that's basically what it is. So we'll test the water and the food and the spices and the medicine, basically all the same things that I listed before, and the soil in their garden, and sometimes we'll go to their school or the place of work of the parents and test media there. There's a behavioral survey and demographic data we collect. And so this is a much more accurate way of determining what in that locale is actually driving exposures and creating a bit of a prioritized list. A quick example of why this is so important. We just wrapped up this in Ghana. And if our program team had asked me like there's a call for proposals. What should we work on next in Ghana? I would have said, oh, we should work on battery recycling and aluminum cookware and contaminated sites, because that's what my gut and experience tells me is what's driving exposures in Ghana. And I would have been dead wrong. The in-home assessment suggests that the #1 correlation so far that we've seen between poisoned kids in Ghana and the presence of a contaminated item is eyeliner. A specific kind of eyeliner that is very common in Muslim communities that they apply to children, and it has religious and cultural traditions and significance. And none of us would have guessed that. It was a complete surprise. But it may well be the #1 driver of exposures in Ghana. So that's just, I think, an anecdote about the importance of doing this type of analysis. Your assumptions can really be misleading. My final message here, we delivered this to the interagency, the US government, and anyone else that will listen, is that there's certain things that work within your borders. The US has made tremendous progress tackling gasoline and paint and now pipes. And as we make progress on those sources, the relative contribution of other sources increases. And right now, what we believe and are seeing is that the relative importance of imported and hand-carried goods from abroad is increasing in the United States. And this is not an issue that we can solve by acting within our borders. You can spend all the money in the world in perpetuity trying to test products as they reach our border before they come in, and you won't get even a tiny fraction of the contaminated items, and you'll spend a fortune. You can spend a small amount of money going to Pakistan, where they produce that eyeliner, and working with producers to create substitutes so it doesn't poison kids all over the world, and it's a much better approach. So I'm going to stop there.
Thank you, Drew. That was great. Do you mind passing? Thank you. All right, so we're now going to hear from Amrita about batteries from the tuk-tuk, the ubiquitous tuk-tuk.
Right. Well, thank you, Karen, and thank you, Drew. Should I be able to play my slides?
Yeah,
oh, there.
It should come up. There we go.
Great.
Yeah.
So I have been researching on the electric three-wheeler batteries in Bangladesh for about a couple years now. It started as my postdoc project at Stanford with Erica Plambik at the business school, and also with Chong Wong, who's at UIUC, another professor. And I didn't know much about lead and the extent of lead poisoning. So Drew, the work that Pure Earth has done has been instrumental in kind of bringing me up to speed with what's going on about lead and lead poisoning around the world. And once I started digging into this space of electric three-wheelers and the batteries that go into making these work, essentially I realized the scale at which these are producing lead wastes and producing lead-contaminated areas as well. And more generally, I think the point that I got out of this is that as we're thinking about renewable energy technology adoption, thinking about solar home systems, thinking about electric vehicles as a solution to climate change, we are inevitably leaving a lot of toxic wastes like lead-acid batteries out in the world, and without having proper end-of-life management of these products. So that's kind of the broader takeaway, although we will be talking more specifically about the electric three-wheeler markets in Bangladesh and in Asia. So ground transportation, I think, constitutes about 20% of the carbon emissions worldwide. And so we see a lot of these very fancy electric vehicles coming about, trying to solve this problem of climate change by electrification. Now, there has also been rise of electric vehicles in developing countries, Asia included, but the electric vehicles in these countries look different. So these are typically these electric three-wheelers or electric two-wheelers, which have become a very common form of last-mile connectivity for people who are driving shorter distances, and millions of people take this every time. Even if I go to India, I'd often be traveling in one of these electric three-wheelers. So they're really all over. And in fact, in Bangladesh, these are not registered, so we don't know the exact number, but it's estimated that there are about 2 to 4 million of these electric vehicles in Bangladesh alone. That's more than the number of Teslas that have been sold ever worldwide. So you can imagine the extent of these electric vehicles. Now, each of these vehicles runs on 5 lead-acid batteries. So you can see the size of these batteries. For scale, I'm standing right next to it. So each of these batteries have about 27 kilos of lead. So if you then consider, one of these vehicles is running on 135 kilos of lead. So this study by the International Lead Association, they said that in Bangladesh, because of these batteries, because of these vehicles, a lot of batteries are becoming waste. Lead-acid batteries are becoming scrap or used lead-acid batteries, which is what we call ULABs. So 77% of these used lead-acid batteries is coming from these electric three-wheelers, and 7% comes from solar home systems. Bangladesh has one of the largest installation of solar home systems because of their rural electrification project. So a quick back of the envelope calculation, if we consider the number of these vehicles, the life of these batteries, and the amount of lead in each of these batteries, we get to the number of 180,000 metric tons of lead that's being recycled every year in Bangladesh from these electric three-wheelers. And another 12,000 metric tons of lead that's being recycled every year from the solar home system batteries. And now taking that point of, majority of these batteries are being informally recycled. The industry's experts say about 80% of the lead in Bangladesh is being informally recycled. So we can take 80% of that, the amount of lead that's being recycled, and consider the 15 to 20% that's going into the environment when this lead is being informally recycled, and then we can get a number of the amount of lead that's coming out as a result of adoption of these renewable energy technologies. Now, lead-acid batteries don't have to be recycled informally, right? Like, there is a process for recycling lead-acid batteries in a very, very safe way. In fact, I think it's one of the most recyclable materials, where 99% of the lead in a car battery that you use in the US can actually go into manufacturing a new car battery. So the lead that's recycled can be done in a very economic way and can create, the material will retain its kind of almost virgin quality on recycling. And that's possible because you have these very strict laws of battery use, battery management, and disposal and recycling. Now, in countries with weak regulatory capacity, such as Bangladesh, where they do have laws, there is a law for handling of batteries and proper recycling. You need to have, quote unquote, the DOE licenses to operate your formal facilities. But that's not the reality on the ground. What we see is a lot of these informal facilities, and Rio already showed you some pictures, and here I have another one of another site in Bangladesh, which is more out in the open, in the agricultural land, where this is a video that the team took on the ground, where you see these pits where you put in the lead parts, and you take a few bags of coal, and you smelt it overnight, because you can't smelt it in the day, otherwise people can observe the smoke that's coming out. And once the regulatory bodies come and they break these pits, then they just pick up, move to another location, leaving the contaminated site for pure earth to clean, right? And there are thousands of these sites, and they constantly keep moving, creating this tremendous amounts of, I guess I shouldn't be saying creating, it might be potentially one of the sources of lead, which results in a really high average blood lead level among children that we observe in Bangladesh. In fact, the UNICEF Pure Earth report said 7.87 microgram per deciliter is the average blood lead level, which is twice the CDC threshold of 3.5 micrograms per deciliter. So essentially what, again, trying to bring back to this point of renewable energy technology, creating a lot of toxic waste, we need to be considering the end-of-life management of these batteries very, very carefully. And electric vehicles continue to grow in developing countries, including especially in Asia. So this is a chart of the expected growth of electric three-wheelers in the world, and China and India are very prominent. And if you also look at the growth of electric two-wheelers, you also see a lot of Asian countries. Now, lithium-ion is penetrating the market, but it hasn't reached the levels that one would not see lead-acid at all. In fact, lead lead-acid batteries continue to be the dominantly used batteries, and they will continue to be so because they are much more economic than using lithium batteries. And I can talk about the challenges of introducing lithium into these batteries, into these markets as well. But that aside, we need to consider where should we be intervening to reduce the lead poisoning, given the increase in adoption of these electric vehicles. So we know we have a weak regulation in the country, or weak regulatory capacity in the country, and we know we need to contain the informal recycling and reduce the lead emissions. So we have been studying from a business perspective, because I'm a business school faculty. So we're trying to understand what are the incentives, the economic incentives across the supply chain, and how to align them so as to incentivize everybody to do the right thing in hopefully reducing the lead poisoning or the lead emissions. So we have this market in Bangladesh, which is the manufacturers selling these batteries through the dealers to the battery users. And the typical life of these batteries is extremely short. They last about 8 to 11 months, in which they drive about 10 to 15,000 miles only. And if you look at this blog from Tesla in 2006, so that's about 17 years ago, they say that if you drive your car 50,000 miles, you will still have 70% of the energy capacity remaining. And here we're talking about these vehicles that are driving a fifth of that 17 years later and are completely disposed, have to be completely disposed. So the very economically poor people, which is these electric rickshaw drivers and owners, are kind of being left behind in this ineffective transition to vehicle electrification. A question to all of you guys. What % of the used lead-acid batteries do you think go into the landfill?
0.
Exactly. Well, thank you. And why 0? Because lead as a commodity, it has economic value. Yeah. So these used lead-acid batteries retain about 40 to 50% of their value at the end of life. So all of these batteries are going back from the user to the dealer where they buy the new batteries. Now, from these dealers, these batteries are going into informal recyclers and to formal recyclers. Now, there is sufficient capacity. When I say formal, there's obviously semi-formal, as Drew showed as well. But there is sufficient capacity in Bangladesh to do 75% of the lead could potentially be formally recycled. But what we find is very low utilization of this formal recycling capacity. So even though there is fixed capacity, it's not being operated by the recyclers. And the reasons for that we have found is the high operating costs, so including energy costs, including environmental costs, or the costs associated with meeting their environmental regulations. And also there's tax avoidance. If you're doing informal recycling, you're paying 0 taxes. Now, if we think about the battery manufacturers who are users of these recycled lead, they're either sourcing lead from the informal suppliers, informal recyclers. They're also buying lead from the formal recyclers, who we also know are sourcing lead from the informal smelters as well. So it's not that the formal smelters are actually doing formal recycling. Sometimes they would collect the batteries themselves, but actually get the smelting done informally to reduce their operating costs. And the third source is they can also just import lead from outside. So what incentivizes the battery manufacturers to source lead from the informal sector? Again, they may or may not be aware that the lead that they're using is actually informally smelted, especially if they're buying from the formal source. But there's also financing and inventory costs that is lower if they are sourcing from the informal sector. So we have been studying this entire kind of supply chain, the entire market, to figure out where it is that we could potentially be intervening to reduce the lead emissions. So one that is kind of obvious is, well, we should increase the quality of the batteries in this market. If we can extend the life of this battery or increase the life of the batteries by twice as much, we will be reducing the lead emissions by half, right? We'll be reducing the recycling rate by half and therefore the emissions by half. The second is there is some fixed capacity to recycle, but we know that the formal recyclers have working capital constraints and supply chain constraints. So that's an area that we are trying to figure out what are the different incentives that could be provided to the formal recyclers to improve on that. And the third is how do we incentivize manufacturers to source their lead more responsibly? What are the cost benefits of doing that? And one of the cost benefits that we have been studying are warranty costs, because if you use poor quality lead in manufacturing your batteries will be failing fast, and that will incur high costs for the manufacturer. And there might be very many other ideas out there that I'd be very happy to discuss on what can be done in countries with weak regulatory capacities to improve or reduce lead emissions. And this is a very complex market, and obviously we have to work with a lot of local and international partners to kind of understand and then hopefully intervene. So thank you.
Thank you. Thank you so much. That was really, really interesting. So now we're going to move to sources of lead and talk a little bit about impact. And we're going to start with Anna and the link between cardiovascular disease and lead. So you have your PowerPoint? Great.
Yes.
We're going to get that loaded, hopefully, in just a sec.
Good, but I can just start. First of all, thank you so much. It's a real honor to be here, and thank you to Pure Earth and the Center for Global Development for this opportunity. And we are going to be talking about health, and we care about lead because it has health effects to humans, but also to the environment and to animals. It's a real ecology, one health problem, which is very important. But if you ask around, if you ask people what are the health effects of lead, the answer tends to be related to the impact in children and cognition. That's what people know the best. But in the slide before, I showed how really is a big impact in adults, and with many health outcomes. And one reason is because lead is really persistent in the body. It stays there for decades. You cannot really get rid of lead once you are exposed to it. So any child, as they are growing older, they are keeping that lead in there. And also because it really is affecting all organs and systems, most of them in the body. So this was a big week for me personally, because of the American Heart Association, after decades of work with many people working in this area, has recognized for the first time that lead is a cardiovascular disease risk factor. So this is really a big, yes, thank you. But this is actually not new. And the first evidence that lead affects the cardiovascular system comes from this paper in 1886, published in the British Medical Journal. So this is not new at all. Somehow this knowledge got lost. And as the lead got introduced in gasoline, in paint, in gasoline, even Alice Hamilton, the first female professor at Harvard, tried to avoid that lead would be added to gasoline. But really, the knowledge of lead and cardiovascular disease was not out there. There was understanding of the toxicity, but it was not that old knowledge that I showed earlier had kind of been lost. And for many decades, that connection between lead and cardiovascular disease was not really fully recognized. It is not until more research got done, like with the CDC, NHANES work that was mentioned earlier, connecting lead with cardiovascular disease, that really made it really be aware, that awareness came back. And it's really interesting because if you look at the peak of lead production in the US, that year, 1968, is when production peaked. Very interesting, if you look at the rates of cardiovascular disease in the US, the same exact year is when the epidemic of coronary heart disease peaked. And after that, there is this huge decline. And everybody was shocked in the cardiovascular community. Why did we see this change in trends? It was not really explained by changes in cardiovascular medical practice. It was not changed by even smoking rates, other risk factors, couldn't really explain. So I like to be very provocative. And I like to say maybe this dramatic change in lead production with the banning of lead in gasoline and all the things that happened during that period, and maybe we played a big role in preventing cardiovascular disease, which has been completely unrecognized. No credit, zero credit. I think that it was discussed earlier about how much money it's allocated to lead prevention programs. Which recognition do we get from the environmental side because of contributing to the decline of cardiovascular disease? Absolutely zero credit. So this is really important. And this work, for instance, lots of papers have been done in NHANES, which is an incredible resource. And that's this study in particular published in Lancet Public Health really showed that lead could be a major contributor to cardiovascular disease rates. But we are talking more than 400,000 cases of cardiovascular disease annually in the US that would be due to lead exposure. So these are very big numbers. And the British Medical Journal, more than a century later, published this systematic review recognizing several metals as related to cardiovascular disease, and lead was clearly related with the studies available, relatively high quality studies, at the same time limited. If you think of how much money has been spent looking at lipids, blood pressure, smoking, how many studies do we have globally looking at those things? How many studies do we have looking at lead? It's tiny amount. I don't think even the gallon of water would example. It would be like, I don't know. It would not be a cent compared to 100 billion, I don't know. We would need to make that number. But several studies have shown this. I am bringing this study from the normative aging cohort, which is a cohort from Boston, because they have the measure of lead in blood, but also the measure of lead in the bone. That is where it's cumulated. And this idea that maybe this cumulative lead is important, but I would argue that the blood lead is also very important. And I am going to show you a little bit of more why this is happening. So lead is not only related to these clinical outcomes, premature mortality, all of this data, we have it, but there is also quite a bit of the subclinically, the how is it happening? And we have that evidence. And especially with blood pressure, I would argue that cognition and blood pressure are the two things that people tend to know, that lead affects blood pressure. That's also quite relatively well known. And I want to show you here some data, which is from the Strong Heart study. This is a study in indigenous communities in the US, in Arizona, Oklahoma, and North and South Dakota. And in this study, what is interesting is what we have repeated measures. And working with the CDC, in collaboration with the CDC, which was really great, the wonderful metal lab that has done the analysis of lead in NHANES, and we were able to leverage some of this data and do repeated measures of blood lead in a small subset. Because again, we are doing this with very little money. We are doing this just because we believe this is important. And we were able to get this data where you can see the histogram is showing the decline in blood lead between late 90s and 2000, and late 2000. So over a 10-year period, you can see lead has declined in blood. And which is very interesting is that in parallel, we can see that systolic blood pressure levels have declined. This is really compelling because it's telling you there is a relatively short-term benefit, that if you can remove the lead from people's blood, that you can actually get a relatively short-term impact and benefit in reducing blood pressure levels. So this is really very interesting, and we really want to pursue this work. We actually have data now with the blood lead and clinical cardiovascular outcomes in this cohort in the Strong Heart study. This is really interesting, and we hope to be able to finalize that work in the next coming months because the data are, again, compelling, and this is a very consistent relationship in all the populations that we've looked at that lead is related to cardiovascular disease. And there is a lot of mechanistic research. This is a slide that you don't even want to look at if you are not interested in toxicology. But this is to let you know that, yes, there is a lot of very compelling, experimental, carefully done research showing that lead is a cardiovascular risk factor. But what happens if we can remove lead from the environment? We mentioned that earlier with the systolic blood pressure. Let's look again into NHANES. Amazing declines in blood lead in NHANES, really dramatic over decades. And if you look at cardiovascular deaths, dramatic decline. So with my colleague Maria Telles, we thought, can we see if that change in the decline in blood lead really explains the reduction in cardiovascular deaths? So we look into that more carefully, and yes, we could see that 22% of the decline in cardiovascular disease in the US would be explained by the changes in blood lead levels. And this is not, it's not it's modeling, but it's a modeling with real changes in data, not a hypothetical attributable fraction, which I believe makes it really powerful and very important. And a little bit with cadmium, also we found 8% of the decline. And actually together, it was like around almost 30% of them together. So very, very compelling, powerful data from NHANES. Can we do something about removing lead from the body? We've said we keep our lead in our bodies, in our bones, in our tissues. That's it. Once you are exposed to lead, you have it. That sounds very sad, and that there is nothing that you can do. But this clinical trial I am showing you was published in JAMA in 2013, led by Tony Lamas, a cardiologist who was a very traditional cardiologist and didn't care anything about lead. But a patient one day asked him, should I chelate metals from my body? And would that be beneficial for cardiovascular disease? And he thought, that sounds ridiculous. But then he thought, why did I say that? I don't have any evidence to say that to my patient. So he started reading, he started thinking, and ultimately there was some funding, the trial was done, and EDTA is a chelating agent. It can remove lead from the body. And when they completed the study, they found that actually it was beneficial. In people who had already a myocardial infarction, there was an 18% reduction of risk above all the traditional treatment, like statins and blood pressure medication. Above all of that, you still saw a benefit. But for people who had diabetes, there was a huge benefit. And diabetes is one of the top risk factors growing globally. It's a major problem in many countries. India, Bangladesh, all the countries we are talking about have a severe epidemic of diabetes. So this could be really relevant too. And if you look at these are the Kaplan-Meier curves for those of you who are interested in statistics, and you can see the huge benefit. And the benefit, interestingly, persisted even when you finished the treatment, supporting that the benefit is because you've removed something from the body that was toxic that you no longer have there. And that's something you don't have with statins or other medical cardiovascular treatments. You need to give the medication every day. But in this case, it seems that something had happened because of the treatment. And this picture just shows if you take people with cardiovascular disease across the US and you give them a chelating agent, everybody has lead in their body. Lead is such a persistent chemical, so important in this country, that still today, people have a lot of lead in their bodies. But the FDA couldn't approve the study, this treatment with a single trial, which we understand. There are lots of safety and regulations that are needed for a clinical practice. So a new trial was funded. This is called TACT-2 study. TACT-2 is ongoing, but almost finished. It's 1,000 people all across the US and Canada are recruited. And they received the treatment for a year. They now completed the study, and it's going to be unblinded in the fall. So in the fall, we'll be able to know if there is confirmation or not. And depending on that, FDA indicated that it would be recommended to potentially use this treatment for cardiovascular disease, at least in people who have cardiovascular disease and an MI already. I am going to show a picture now that it's a little bit hard to look at if you're not used to medical practice. Because
warning everybody.
Yeah, I am just warning you because there is a form of cardiovascular disease that is very severe, which is called peripheral arterial disease. When you have this disease, it's very painful, like it's like a myocardial infarction, but in your legs, and it's extremely painful. People cannot walk. It affects quality of life tremendously, and it results in amputations. So the pictures that I'm going to show you show these amputations and show this necrosis that is induced because you don't have enough flow going to your tissues. So your tissues are dying and you suffer a lot of pain. This chelating agent showed incredible improvements in vascularization for people with this condition. We can see it because it's this peripheral form of the disease. When you have this disease in your coronary arteries, you don't see it because it's deep in your heart. So this treatment, potentially this is the same that is happening. There is an improvement in vascularization from removing lead from the blood. And so there is potentially it could be a game changer for the treatment of cardiovascular diseases. So we'll see. We'll have to wait for the new trial. So I am going to finish now. And this slide is, it's all what you've been talking about. Why do we have so much lead? And this is still a persistent problem. Everybody, when I go for grant funding from the NIH, nobody wants to give me any money because they said we've done everything for lead. There is no more research is needed. But we persist because we think this is really important. And I just want to finish with this last, the lead production, because lead production continues in the world. It's actually growing. I couldn't believe these numbers, that we have more lead production in 2018 than we had in 2006. That doesn't make any sense to me. If we can't recycle lead, why are we still taking lead out and producing it? So that's really important. And there you have the list of countries involved in lead production. And personally, my goal is to bring the environment to clinical practice, to medicine, cardiovascular medicine. And this is a collective effort. Lots of people are needed. Everybody has something to contribute. So please talk to your doctors. That was what mentioned earlier. If your child has lead poisoning, test everybody in the family. This is not a children problem only. The parents should be tested too. The pediatrician should be talking to the other clinicians because there is something important for the family. And I just want to finish and thank everybody in our group at Columbia for making this possible.
Wow. Thank you so much. Okay, so now we're going to go from health to education. And Lee's going to give us a presentation on that link between potentially education outcomes and lead intake.
Thanks very much. So I'm an economist and I focus mostly on education policy in low and middle income countries and spend most of my time thinking about school quality. So in the global space, we talk about the global learning crisis being the fact that millions of children have started going to school for the first time. Has been incredible success in getting children into school, but the quality in schools remains much too poor. And when we started looking into lead about a year ago, there's increasing evidence coming out from economists looking at the causal effects of lead on student test scores. And we were interested in how much potentially could this contribute to addressing this global learning crisis. So we know that we're pretty sure that it matters. There's the biological mechanisms, there's experiments with animals, there's quasi-experimental evidence with humans. We're pretty sure this matters, but there's still a question of how much does this matter compared to all of the education work that we're doing. So we set out to answer this question. This figure just gives you the scale of the learning crisis. So you may have heard of the PISA survey, which is this international survey of mostly rich countries. The US scores about 550 points or so on that. The average in rich countries is about 500 points. The low benchmark in this survey is 425 points. So below that, that's kind of your basic reading proficiency. You can read for understanding. The average in low and lower middle income countries is 350 or so. So it's way below this benchmark. Most children in the poorest countries can't read for meaning at age 10. So it's this big, big problem. And lead is making a contribution to this problem, but just how big of a problem, we're not quite sure. So this is just some data on blood lead levels. We've discussed this already, but the average level in many countries being well above the CDC threshold of 3.5 micrograms per deciliter. So what would happen if we could reduce these lead levels down to close to 0? So the US level is around 0.5. So that's kind of the question we set out. And we start with these quasi-experimental studies, of which there's a few. And this is an example from Sweden, showing the before and after the leaded petrol ban in Sweden. And you can see there's some areas on the left-hand side in bright green where they were quite rural to begin with. So there wasn't a lot of lead exposure, even when there was still lead in petrol. So that's kind of a nice control group. Before and after, there's no change. But then these red areas, they've completely changed before and after lead was removed from gasoline. So you have this nice natural experiment here, and you can see there's a causal effect of lead on learning of children. But what we don't have here is direct measures of blood lead. This is entirely a reduced form relationship, we call it in economics. We know that there was a policy change, and we know the mechanism, but we don't have the direct measure of the mechanism. What we do have here is environmental lead. So they have soil testing in Sweden at a very local level. And so that matters. If we're trying to figure out how much would reducing lead in developing countries, how much would reducing blood lead lead to test scores, we need to know that dose-response function, like what's the relationship between blood lead and learning. For that, we have a whole raft of observational studies. And so this just shows you a few of them. It shows, it's pretty consistent. There's this non-linear relationship between blood lead on the x-axis and test scores on the y-axis. Much of the medical literature is focused on IQ detriments. In the education space, we tend to talk about reading and mathematics test scores. So that was the other part of this, that we kind of set out to find some of these studies. We didn't intend to set out to do a systematic review, but we ended up doing a systematic review and trying to find, ultimately, the almost 50 studies that we could find that measured the effects of the relationship between blood lead and test scores or IQ, almost 300 different estimates, and we bring those all together. Interestingly, the effect is identical between mathematics and reading and IQ when you express it in standard deviations. So, I had heard when we came into this that as being lead exposed might reduce your IQ by a few 3 to 5 IQ points. To me, we work in standard deviations, and so we now have a comparable number from all of this literature, which seems fairly consistent. But again, these are these observational studies, not the causal studies that we'd like to have. And so we do some adjustments to try and account for that, and to account for the fact that some of these studies are on IQ, which we're less interested in. Some of these are from high-income countries, some are from low-income countries. We're more interested in the low-income country studies. There's a certain type of study that there's an ideal study out there which doesn't exist that we would like to kind of recreate from this data. And so we do this, we run this meta regression. How am I going to explain this? We try to adjust this estimate for confounding variables. So did the study include adjustments for parental income or parental education? That makes a big difference because if you're poor, you're more likely to be exposed to lead and have low test scores, not because of the lead, but because you're poor. So some studies, the better studies control for that and try to adjust for that. The better studies have multiple measures of blood lead because measures are noisy, they're not perfect. We're just for publication bias. There's some indication of some publication bias in this literature, as there is in many of the literatures. It doesn't make a huge difference to the effect. We've put all of these controls in, and it brings the estimated effect for a one natural logarithmic unit increase in blood lead, which is roughly a doubling in blood lead, reduces your test scores by the effect goes from 0.2 standard deviations down to 0.12 standard deviations. So it reduces. This figure shows you every possible specification you could do. So it's not just that we happen to choose these few controls. It's pretty robust to however you want to present it. So we arrive at this number of 0.12 standard deviations per log unit of blood lead. What on earth does that mean? So we then take the data on where countries began with their blood lead. And here we simulate what would happen if you took that down from the average blood lead level in that country down to 0.5. And we now have this dose response curve, so we know what the effect is. And so this graph shows where countries are starting at in terms of this harmonized learning score measure and how far completely eliminating lead would take them towards this kind of average of 500. And it takes you a decent way. It's about a fifth of the gap on average between low and middle income countries and this rich country average, which is pretty substantial. We know there's lots of other things wrong with schools in developing countries, like the teacher training isn't great, and there's all sorts of resource constraints. They don't, a ton of problems with education systems, but it seems like this could make a substantial contribution. Obviously, completely eliminating lead overnight is it's going to take some time. It's hard. So what's feasible, and how do interventions to reduce blood lead, how do they stack up against an education intervention, for example? So this overall effect size from reducing lead down to rich country levels completely is around 0.28 standard deviations. That's about the same size as a big $50 million USAID reading program in a developing country that's focused on teaching children to read. So that's quite a big effect. This is not a systematic review, but we then went out and looked at different interventions designed to reduce blood lead and the kind of effects that you would see from them. So the observed reduction in the US, showing what's possible, is still quite a big effect. That's the second bar. The third bar is soil remediation, many of them the kind of projects that Pure Earth run, which are quite expensive and resource intensive to do in the most exposed areas, but they show big reductions in blood lead. Calcium supplements in some cases, the evidence is mixed here. Some studies don't show positive effects in the US where people aren't calcium deficient, but in contexts where people are calcium deficient, that can make a difference. The leaded petrol bans in low and middle income countries. Most of these aren't experimental studies, but just looking before and after, there was this reduction in blood lead, which still leads to these meaningful effect sizes on learning, pain remediation, parental education. There's a raft of interventions which have effect sizes which do stand up to education interventions. So a colleague here, Dave Evans, has a review of every intervention in a developing country that's an education, a school-based intervention. And the average effect size is around 0.1, so kind of in the middle of these interventions, which are not focused on education at all, but obviously have that effect on cognition and therefore learning. So yeah, I'll stop there. It seems like it can make a sizable contribution.
Thank you. Yeah, thank you. This panel is amazing. We just have a few minutes left, but if anyone wants to ask questions, I can take a couple of questions since we have had so many provocative and thoughtful things going on up here. So please don't be shy because you're going to miss your chance and I'm going to ask questions. Seriously. All quiet. Yeah, go ahead.
Yeah, I didn't want to go into details because of time, but it's so the chelating agents, lead is a cation, and that's the reason why it's a cationic element that binds to our own proteins, to our own amino acids, and forms this very strong bond. That's why we cannot eliminate it from the body. But this chelating agent is an anion itself. It's like an amino acid. It's an artificial amino acid. So when it's in contact in blood with lead, it has a stronger affinity for lead than our own proteins. And now this compound is an inert compound that can very easily eliminate it through the urine. And that's the reason why it works. Yeah.
Thank you. Any other questions? Yes.
Sorry, same question for Anna. So it sounds like from your results, it's important to. Sorry. It sounds like from your study, it's also very important to monitor the blood levels in adults. But what are some of the difficulties or challenges that you have encountered when advocating for this idea, and how would you foresee a system for?
I think it's a really difficult question. Should we monitor lead in adults or not? And so that's why what my suggestion is maybe to start, for instance, with when the child has lead poisoning, when a child is above the threshold, the parents, the family should be assessed, everybody in the family. It's not just an issue of the children. So that would be a way to start. Another way to start would be like in communities where we know that there are many children affected. We should also then take a more comprehensive approach, and clinicians in those communities should be checking for lead in adults also. I think there could be lots of intervention that could be really developed and improve our surveillance systems for adult populations too. So those are some ideas, but I am sure that if we had a group of people, we could develop a much greater plan. Yes.
Thank you. That was amazing. Just to comment on that, in New York City, we have childhood lead poisoning surveillance, but one of the paper that's out there in one of the tables, we had a family of 5 that included a really young child, less than 5, mom and dad, and 2 college-age students, all lead poisoned. They were using the ceramic ware that they purchased in Mexico. So the guidance we provide is for public health officials and physicians, etc. If it's a communal source, if we have to focus our resources and investigate, if there's a suspect communal source for the child, yes, look into the adults as well, because it's the exposure.
Thank you. Any other questions for the panel?
For the first 2 panelists, we talked about how it's important to stop lead at its source. What are some of the most promising sources that we could try to tackle? How do you go about actually enforcing, preventing lead from getting out of those places and, onto the market? And then is one of those sources, what is the feasibility of maybe going to the lead battery manufacturers in India or in Bangladesh and, mandating that they can only purchase their lead from formal recyclers? Because it's a global market, will people start buying batteries from other countries where they don't have this regulation and it's cheaper and whatever?
Mind if I take a stab at this?
Oh, please, yes.
So let me break down sources into 3 baskets. I think the community of lead actors, there's some consensus around the low-hanging fruit is products that can be regulated pretty easily. So this includes paint, spices, cosmetics, regular consumer goods where there's often a law on the books, or maybe the law just needs some adjustment, and there's just a gap in testing the product in the country and enforcing the regulation. I think there's consensus around that's kind of the low-hanging fruit. Then there are ones where we know solutions, but the solutions are hard. And I would put lead-acid battery recycling in that basket. There have been successes. High-income countries have a great system. We don't get poisoned by battery recycling here. There are high-income countries where they do a lot of recycling, and it's good. But there are perverse economic incentives in low-income and middle-income countries that kind of boost the informal and substandard sectors. So there's solutions around changing tax regimes and economic incentives. And then one solution I'm really interested in is business-to-business pressure, kind of business contractual pressure. So people that are either selling huge volumes of used batteries or buying huge volumes of recycled lead have enormous potential pressure to apply on the recycler in the middle, saying, yeah, we'll do millions of dollars of business with you, but you need to perform here. So that's the known but hard basket. And then there's one, maybe more than one, that I don't have any idea what to do. And that's like aluminum cookware. This is made in small batches in every little town. And it's unregulated, it's an informal activity, and that's just going to be hard to sort out. So we're thinking hard about it. We're testing hundreds and hundreds of pots right now in our office. But the solution, at least for me, remains kind of unknown at this point.
Right, thanks, Drew. I think that's really well put. And another bucket, if I could think of, would be who's the end consumer, and if the end consumer is being affected by the lead directly. Because there an advocacy or like education around like, well, don't use these ceramic plates, or like, educating the consumer, in my opinion, is probably an easier way to get about it than actually, at least in low-income countries, to go to the regulatory bodies and then asking them to make these really like big tax changes, or providing financial incentives, which without proper understanding can also backfire. Right? So if you're providing tax incentives, it should be done in a way that in the long run, the industries are incentivized to actually do the right thing. So another one is, if this is an export-oriented industry, then you can induce the buyers who are situated in countries with stronger regulation to put that pressure on sourcing. But when these are domestic markets, then that becomes more difficult, because these players, the suppliers and the buyers, are also interacting in the same regulatory regime, where not a lot of compliance is ensured. And also in battery industry, it's also more like the aluminum cookware, where we've found very, very small manufacturers and recyclers, and it's absolutely informal in many ways. So it is really a very difficult problem. And I don't know much of what we can do except for what we're currently thinking on.
Can I add one more note to the battery topic? What we've seen is basically the informal sector doesn't pay taxes. And when the formal sector wants to buy a pallet of batteries, they have to pay VAT or some other kind of sales tax. And so that's just one of these perverse economic incentives. So what some countries are doing is eliminating the VAT on purchase of used batteries, just to level that playing field so the formal sector doesn't have to, so the informal sector can't outbid the formal sector by not paying tax.
Okay, thank you. I'm going to have to bring it to a close, I'm afraid. So just a couple of takeaways that I wanted to mention. I mean, we're learning more and more about the dimensions of lead and its impact on society, and it's not good. Nobody's come up here and said, well, on the positive side. So I think that's really important to bear in mind. And also the fact that production is increasing means there's more and more lead in circulation, which is going to make our job harder and harder. So it just increases the case for doing something about lead. And then, as we heard from Drew, we're getting a pretty good sense of how to go about it. Going into communities, testing the blood, determining the source. So there's a process, and it's time consuming, but it's not hugely expensive relative to so many other of the demands on international resources. So I think the bang for the buck would just be huge. So I'm just asking everybody to help spread that message, because it's just not getting out. So I think that's sort of our collective challenge. So if we could have one more. Thank you. You guys were great. Thank you so much. And I think everyone should be back at, 5:15 for the last panel? 4:45. Never mind, 4:45. Okay, sorry about that. Oh.
Ladies and gentlemen, today's final program is about to begin. Please come on into the event space and take your seats. Our presenters are about to hit the stage. We're about to begin our final presentation of the day. Thank you.
Okay. Hello, everybody, and welcome back. I hope you enjoyed your break. During it, I found out that my earrings are full of lead. So that's the news of the day from my perspective. It's been exciting times here. I'm going through all the stages of grief and currently still wearing them, so make of that what you will. So we've talked a lot about why lead is bad. Sorry. Don't want it to make scarf noises, want it to make people noises. We've talked a lot about why lead is bad and what we should do about it, but we don't want this to be too much of a bummer. So now we're going to talk about all the great things we can do to, in fact, get the lead out, and some really important success stories in doing that in pretty short periods of time in pretty dramatic ways. So, we want to leave you all with the correct impression that this is serious, but it's tractable. There's something you can do about it, and, get out there and do it. So I'm joined today by 3 panelists who are all on our working group on lead understanding and mitigating the global burden of lead poisoning. To my left, we have Paramita Hore, who's the director of the Environmental Exposure Assessment and Education Program at the New York City Department of Health and Mental Hygiene. And she is going to talk about how we get the lead out of New York City and also consumer products. Then we have Rich Fuller, who is the founder of Pure Earth. And he's going to talk about how we get the lead out of spices. We've heard a lot about spices. Turns out this is a very solvable problem, so let's hear about how we solve that. And finally, we're going to go to Lucia Coulter, who is the co-founder and co-executive director of the Lead Exposure Elimination Project called LEAP. And she's going to talk more, we've heard a little bit about this already, about how we get the lead out of paint so it does not go up on new walls and homes and preschools and get eaten by small children for decades to come, because that is bad. So first, over to Paramita. We'd love to hear, what are you doing in New York City, and how are you getting the lead out of children, homes, and products?
Hello? Is my mic working?
Yes.
Good, good. Yeah, solution-based. Some things to put out there. I know Dr. Anna said, or the previous panel said, nobody's saying on a positive note. Well, on a positive note, we're having a dialogue. We don't have 140 years, so let's expedite. And work smart, not just hard. Some of the mottos. So what are we doing in New York City? And how can it really trigger or at least supplement some of the global efforts to reduce the exposures, to eliminate the exposures? That's the goal, right? So I've been with the New York City Health Department for almost 20 years. And today's presentation, I'm really going to talk about around consumer products, lead-containing consumer products. So before we delve into the types of consumer products we've seen, how we share information with global authorities, NGOs, such as Pure Earth, to basically make the change at the country of origin, I want to paint a picture of how do we identify these products in the city. Some of the referrals were discussed in some of the previous presentation. Dr. Kapil mentioned about the childhood lead poisoning prevention grants that are given out by Centers for Disease Control to 62 jurisdictions throughout the country. We are a locality, we're just a city, a big and mighty city, but we receive one of these grants as well. And so there's routine surveillance of childhood blood lead levels in the city. And also we get funding indirectly, but to survey adults as well. There are laws in place that make certain populations, like young children, get a blood lead testing. And we at the City Health Department, we get all of the blood lead reports of every New York City resident, whether it's a child or an adult. There are protocols in place to investigate. Essentially, the investigation involves a detailed risk assessment interview where our investigators ask questions about potential risk factors, right? We know a lot of information on how lead exposures can take place, but we are also, and so we follow the literature as well, right? So, and during this risk interview, we also ask about consumer products, things informed by literature, things informed by other jurisdictions, things informed by global authorities, federal authorities, we're finding lead in this or that. We incorporate that in our investigation, and we do products testing as collected during these investigations. Something else that we do, if we are finding hits, whether we're finding it through our cases or these reports, we go undercover shopping, looking for these products in New York City stores, right? It really is a multi-pronged approach, and we'll also talk about how global impacts can take place. And this data, all of the product samples that are collected for testing through these investigations or store surveillance are maintained, systematically tracked in a database. I'm an engineer by training. Everything has to make sense logically. So systematically tracked with metadata of the products. What is the product called? Where is it from? What is it used for, etc. It's also open to public, scan or ask me. So through our website, this data. So when you build data, what happens? You build patterns, right? Who's at risk? What are they at risk for, etc. This is a map of all the various parts of the world where our cases reported that they purchased their products that we found detectable levels of lead in. We're lucky because New York City is a mixing pot. So I call this, and Rich and I have talked about this, it's a signal. Think of it as a signal. I think the first step, or first in any of these changes that we need to make, we need to build data. And so at least we've started this in the city, over 10 years worth of data, but we're really pushing for more data nationally. I'm just going to go through these very quickly, but there's a lot of information out in the tables out there. Through these patterns, we've seen elevated blood lead levels both in children and adults associated with a variety of different health remedies, traditional health remedies from different parts of the world, India, China, etc. Drew mentioned about the cultural powders, the cosmetics, the surma, the kohl kajal surma. We've seen cases around that, both in children and adults. It is a cultural product or religious product or cosmetic product as intended for use, but it's used for all ages, and the hand-to-mouth exposure is very important. And surma essentially is ground up that lead rock that Rachel shared a picture of. That is what it is. It's galena. On the left here, you'll see sindoor, another religious powder used in Hinduism. We've found high levels of lead in these types of products. Again, associated hand-to-mouth exposure. Amulets, when children mouth these types of amulets, which may be used for various reasons. And they're very widely used, depending on which part of the world you're talking about, for warding off evil eye. South Asia is one of them, right? Rachel was just talking about the jewelry. This is an amulet that a child can mouth and get elevated levels. Maracas from Mexico. So again, these are sort of signals, but, and I'll kind of talk a little bit of, Rich and I are going to tag team how this can inform global work. We're also seeing a lot of cookware, traditional ceramic ware from various parts of the world. We are seeing a lot of Mexican ceramic ware, also very widely available for sale in New York City stores, brick and mortar stores. We have the authority in New York City Health Department to take enforcement actions, and we are. We've removed since 2017 over 8,000 units of lead-containing ceramic ware, but we still have a long list of stores to enforce. That is not working smart, right? That's just in the meantime, but we need to fix it at the source, and so how do we do this as well? So that's our long-term goal. Metalware, some specifically brassware, we've seen elevated blood lead levels in New York City. I do want to kind of throw this a plug in. We have not seen aluminum cookware as a source of lead exposure in New York City's signaling system per se, but that's one of the reasons I would say we need a national repository of this information. We have Dr. Steve Whitaker here from the Public Health Seattle, King County. They're seeing elevated blood lead levels in the Afghani refugee community that get blood lead surveillance associated with use of these types of aluminum pressure cooker with extremely high levels of leachable lead. What does that mean? The lead, you cook the food in this pot, it's going to leach out into your food or drinks, get into your body. Same thing with ceramic ware, right? So the exposure potential is there. And this is just a snapshot of, and this has been touched on in previous conversations as well. It's really the production may be used using metalware that has leaded weights within it. So how do we solve those? Yes.
Can I just?
So I'm going to give it to you, Rich, because you're going to talk a little bit about how you're seeing this abroad.
Absolutely, and we see these problems all through. Can I go back? How do I do that with this?
I think so.
See this top right picture? You can see he's got a car radiator. There's lots of radiator parts there. And what we're finding is that when they're mending those radiators, which are made of aluminium, they use lead solder. So this is going to be a significant source when it all goes into the pot to be melded up to make pans, to make pots. That's going to be a significant source of lead exposure. The other thing that's, I think, really interesting is wheels, car wheels, are made of aluminium. Who knew? I didn't know. And when they get recycled, there's all those little lead weights that they put on to balance the tire. So you can see where secondary aluminium keeps having more and more lead added to it. And a lot of that ends up then going into this kind of cookware. This is part of our RMS study that Drew described before, different kinds of products all across the world in 25 countries, and a huge number of them showing quite high levels of lead in it. Again, just showing again the sources of these lead and secondary lead and where they come from. So one of the things that's interesting about this problem is how are we going to stop this problem moving forward? And as Drew pointed out earlier, we really don't know yet. But we have a research program that we're in process with. And Gordon Binkhorst, who's up in the corner there, is in the middle of it, as is Steve Whitaker, as is Jenna Forsyth, whom you also met another time. All those folk are working to see if there's some way that we can get the lead out of this aluminium when they're making new pots. One potential way that we're going to start testing soon is to put some kind of additive. So maybe there's a scoop of some powder that the guy throws in to the aluminium molten stuff that bonds the lead into the aluminium substrate so it doesn't become bioavailable. This we're going to find out. We're going to test different things and try it and do all the rest of it. We don't know if this is going to work or not. If it doesn't work, we'll try something else. We've got to find, I think, a technical solution to this issue because it's not going to be technically possible to remove the lead from this long, ongoing recycling process that goes on in so many countries. So I think I turn it back to you now, my dear.
I do, yeah.
There it is.
So I think that's just circling back a little bit more to this data, right, that we have in New York City. That sort of signals to some of these types of sources. But they're coming from different parts of the world, and that's where Pure Earth, us, and others we dialogue all the time to try to, if we have limited resources, the solution or part of the solution is focused, targeted interventions. So using some of this as well. This is a publication, again, papers out there on the table. We looked at a 10-year look at our spice data that we collected through our investigations and store surveillance, and almost 1,500 samples over the 10 years. And some of the patterns there were that the average lead content in the spices were much higher for those spices that were purchased abroad. So essentially, hand-carried from other parts of the world. And some of the top countries where the highest level of spices were coming from were Georgia, the country of Georgia, Bangladesh, Pakistan, Nepal, Morocco. So what do we do with that information, right? I mean, it's, again, multi-pronged. We want reactive and proactive solutions to these issues, such as lead sources. So we have approaches we're taking in New York City to educate our New Yorkers. Buy your spices locally. We're not really seeing high levels of lead in, or not to those levels that are poisoning people in the New York City stores. So buy your spices locally. But the big goal is to fix the issue at the countries of origin. So I think, Rich, I'm going to turn it to you, what that effort looks like.
Should we talk together about the Georgia
We are
effort?
going to. It's going to, yeah.
So here are some spices. It's not just turmeric. We always talk about turmeric, but it's really anything that has a bright color. Marigold gold. Drew, is that the name of it?
Marigold flower.
Marigold flower is a product you can buy that you use to color your spices. It's expensive, and oftentimes they will substitute lead chromate as the yellow to instead. And it's lead chromate that's probably making that bright yellow color down there. I think I have one more picture here of other ones as well. But there are other colors within the lead salt family that will give you dark red colors, even some greens and other colors that often we find in different kinds of spices. So while we say turmeric, we all understand it because of our Starbucks turmeric lattes and whatever else. It's when you're in country, it's all sorts of different spices that can have this potential to them. Now, does that mean that people are always going to get poisoned from it? Not at all, because let's talk about Georgia. Are we going to talk about Georgia now?
Slide.
Okay. You go first.
Oh, well, so just again, bringing it back to our spice data in New York City, right? We've seen elevated blood lead levels in children and adults associated with spices from the country of Georgia. While we're educating New Yorkers to buy their spices locally, how do we change this problem? How do we change it at the country of origin? As mighty as New York City is, we only have local jurisdiction, and this is not a local New York City sourced problem. This is not even federal, right? It's outside of the United States. Yes, of course, we notify our federal partners. In this case, it would be the US FDA because it's a food substance. So the next step is how to motivate the foreign authorities from which country it is coming from, right? You can pick a country, any country, pick a product, any product, but the example of Georgia, so one of the things we did is, and back in 2011, 2012, up to 2015, we shared our findings around this extremely high levels of lead in Georgian spices that people were obtaining abroad, along with disproportionately represented elevated blood lead levels in children with Georgian ancestry in the city. We shared it with our New York City Georgian consulate so that they could share it with Georgian food authorities, right? That's our protocol, to work with the consulate to notify the foreign authorities. And that's kind of what the model that we have used for other countries as well. But only recently realized that that motivated Georgian government to take action, and I'm going to pass it back to Rich.
The Georgian government then went out looking for someone who could actually validate if this was a problem. After a few back and forths, UNICEF stood forward and said, we will do a blood testing for it, and they corralled money, added blood testing into their MIX program, which is where they go and sample children and look at their health statistics on a regular basis. That found high blood lead levels, just as Paramita was expecting. The next step was the Georgian government approached us to say, where is it coming from? And we came in and did a home-based assessment along the lines that you've already heard about, that found that it was indeed spices that was causing all of this. Then came the intervention, working with a whole set of different groups, mostly government agencies in Georgia. They did an undercover action to work out who was putting the stuff into the spices and when. As well as that, they also did a large public education campaign. They rounded up all the people who were putting the lead into the spices, made sure they were never going to do it again, and large public education campaign to make sure everyone was aware that this was a problem, to be concerned with it, and that did the trick. The mean level in spices reduced substantially, and we've been testing for the last 3 years. Now, almost all of the spices are completely lead-free. We have a before blood lead level from the MIX survey. We're now planning on doing an after blood lead level to test that this is true, and we're hoping to be able to do that in the next 12 months or so. We're still looking for funding, are we, Drew? We're still looking for funding for that, for any funders out there. Georgia was the starting point. We then said, Bangladesh, we know from our source analysis, has a similar problem, and Stanford, it was Jenna Forsyth from Stanford University, who went and initiated a similar kind of project. She had investigators go out and find who it was that was putting the contaminant into the spices, then got the government to round them up, throw some of them in jail, front page news stories, public education throughout, and that did the trick again. There's no more spices in Bangladesh. We've been testing them consistently over the last few years. 150 million people, and we've done blood levels before and after. And while the after blood levels have not yet been published, we do have them. We're seeing a reduction, 66% of blood lead levels reduced in all of this. Just an extraordinary result from a relatively simple intervention. I want to talk about the cost-benefit ratios of doing these sorts of things, because we'll also hear about another extremely effective intervention in a second from Lucia. When these are analyzed to see how much you needed to spend to do this intervention, how much the government needed to spend as well, and then you look at the benefit. The benefit is calculated in terms of future children born who do not have impaired intelligence and therefore have larger lifetime earnings. And it's the lost IQ, the lost potential of those people that you can calculate in terms of economic terms. When we look at those two things, we find that the benefit-cost ratio is enormous, that each dollar generates tens of thousands of dollars in return, even hundreds of thousands of dollars of return. We've done those sorts of analysis for spices. We've looked at it also for work in getting rid of lead from ceramic pottery, and we find also extraordinary rates of return in that area as well. We even find decent rates of return, perhaps 10 or 15 times rates of return, for cleaning up these contaminated sites where there might only be 500 or 1,000 people who are impacted. So lead itself, in almost all of its cases, is a really cost-effective intervention space for those who are concerned about those sort of issues. And I'll turn it back to you to finish, is that right?
Well, this slide, yes.
This is yours.
So the big global picture that we have, right? We talked about through our existing monitoring systems, we identified an at-risk community, the Georgian community that live in the city. We identified an important risk factor for this community. We worked with global authorities and partners who did extensive work in the country, Georgia. And so our signal system should be picking up theoretically an improvement, right? So based on our preliminary data from 2017 to 2022, the rate of children with blood lead levels at or above 5 microgram per deciliter declined 96% among New York City children with Georgian ancestry. And we are also seeing a significant decline in the spice levels, lead detectable spice levels. We're going to do similar sort of exploration of the data in our Bangladeshi community as well, right? That would be amazing. So yes, these issues are big, global, complicated, many challenges, but I want to say that there are possibilities. It requires a lot of networking, a lot of stakeholders, but that's okay, right? Again, maybe public health is a long game, but that's all right. We're all in it together and motivate the next generation. Do you want to say anything? But I think my closing is remember the D's, and this morning's meeting we added a fourth D, data, dialogue, drive change. It's doable.
It's doable. And the spices issue, we think there's about another dozen countries, plus or minus, that can benefit from this kind of work. Again, many hundreds of millions of people who would benefit from this kind of work. But these other interventions we also know can be effective and can move forward as well. So one step at a time.
Thank you, Rich. Thank you, Paramita. So now over to Lucia Coulter. Again, she is the co-founder and co-executive director of the Lead Exposure Elimination Project. And she is going to tell us how her organization is working to get the lead out of paint.
I'll just wait for this. Thanks. Yeah, so my name's Lucia Coulter. I'm co-founder and co-executive director of LEAP. LEAP is an international nonprofit working to reduce childhood lead poisoning in low and middle-income countries. We're a partner of the Global Alliance to Eliminate Lead Paint, and we currently work in 16 countries across 3 continents to end the availability of lead paint. We focus on lead paint because it remains an extremely widespread source of lead exposure, and also because it's an unusually solvable source. This makes it really cost-effective to address. Most high-income countries banned lead in paint half a century ago, but in most low and middle-income countries, it's still unregulated, even for home use. And with population growth and economic development and urbanization, in many countries, more and more lead paint is being sold each year. Lead paint is being used in homes and schools where it'll remain in the environment for decades to come. It forms dust and flakes that are accidentally ingested, particularly by young children. So LEAP's aim is to get lead paint off the market and prevent it from becoming a source of exposure in the first place. So what do we actually do? We run the same 5-step program in all of our focus countries. So I'll talk through those steps now. Step 1, we identify and engage with the relevant government authorities and also with civil society. We offer our support and we usually sign an agreement laying out how we'll work together. And then step 2 is conducting a study to identify if and to what extent lead paint is available on the market. Most of the time, there's no data to begin with, and this is usually the first thing our government partner requests, so we carry out these studies in collaboration. And typically, we find around 50% of the home-use solvent-based paints that we sample are lead paints, as you can see in this chart of studies across 5 countries. And we find that this country-specific evidence is really important to inform and motivate action. And it's also a useful baseline for the regulatory authority and can help them plan enforcement. And it's also really cheap data to gather. These studies cost around $4,000. And then step 3 is we support the government with the introduction of or enforcement of regulation. So this can involve things like providing example laws and technical input with the support of the Global Alliance. It can involve funding multi-stakeholder meetings and workshops, or helping to build testing capacity for monitoring and enforcement. And in this step, we try and be in really close contact with our government partner so that we can be as responsive as possible to whichever barriers are coming up. And then step 4 is engaging industry. So we provide the lead paint manufacturers with one-on-one consultations with an expert paint technologist who has experience helping manufacturers across low middle-income countries with the switch to lead-free or non-lead paints. We also run technical workshops, and we help them identify suppliers of non-lead raw materials. And we also test out these non-lead raw materials so that we can recommend solutions that actually work. And then finally, the last step is follow-up studies. So these will allow us to prioritize further support for monitoring and compliance, and it also measures a key outcome in our monitoring and evaluation. So I'll give an example of what this actually looks like in practice. Firstly, in Malawi. So we partnered with the University of Malawi and conducted a market analysis, and then analyzed all of the available brands of home-use solvent-based paint. We found that half of the paints we sampled had very high levels of lead. We brought this data to the regulatory authority, and they said, what did they say? They said, we haven't been testing for lead because we didn't know it was a problem, and this research has been a wake-up call. And with the new data, they committed to implementing the regulation. We've since been working with them to improve their testing capacity and monitoring, which has been going really well, and they've now conducted their own testing and started enforcement. We've also been providing technical assistance to the manufacturers, and they're now switching to non-lead paints. This is what the largest lead paint producing company in Malawi said. We have found new alternatives. These are lead-free, and there's a small cost increase of 5 to 10%, my microphone, which can be absorbed by the business. So they're not even having to pass those costs on to the consumer. The second example I'll give is Pakistan. So we partnered with the Aga Khan University, and we found that 40% of the home-use solvent-based paints we analyzed had very high levels of lead. The Director General of the regulatory authority said, the data provides valuable guidance on our enforcement of Pakistan's compulsory paint standards, which exist to protect the population from harm. We urge manufacturers to swiftly remove the lead, and we'll be taking steps to ensure compliance. And this is a picture of our academic partners, Dr. Zafar Fatmi and Dr. Amna Siddiqui. And then on the right is the media coverage of the study results. The findings were shared in all of the major news outlets and also on the TV news. We've been working very closely with them since this, presenting at technical committees and running workshops for manufacturers. Now, 10 manufacturers report that they're switching to lead-free, and this includes 5 of the 6 most popular high lead brands that we identified in the study. And you can see the quotes here. There's a quote from a pigment manufacturer who explains that they've had demand for non-lead pigments for the first time. And there's also a couple quotes from some of the paint manufacturers talking about their steps to switch to lead-free. And we're continuing to support the regulatory authority, and now we're working together on national testing to support further enforcement. So, oh yeah, and this is some of the media coverage from last month following the joint manufacturer engagement, and it highlights the progress we've made together with the regulatory authority over the past few months and our ongoing partnership to get lead paint off the market. So, well, since 2021, 6 governments have committed to introduce 4 countries, manufacturers are already switching to non-lead paint, and we've now expanded to 16 countries. And in all of them, funding permitting, we expect to reach the point of manufacturers switching to lead-free in the next 2 to 3 years. And we expect this to reduce lead poisoning in millions of children. But of course, there are many more countries to go. Still 71 countries without regulation, and many more where regulation is not well enforced. And as well as LEAP's progress, the Alliance more broadly, including the nonprofit IPEN, has made significant progress, particularly through the SAICM-JEF project, which ended last year. During this project, I think 19 countries introduced lead paint laws, and in 7 countries, manufacturers completed reformulation pilots. So how has all of this progress in getting lead paint off the market been possible? I think there are a few reasons. One of them is that the government and industry barriers are actually surmountable with relatively small amounts of support. We find that generating local data, giving technical input to government and industry, and providing small amounts of funding for workshops and meetings can be enough. Another factor is that there is this credible recommendations and guidance available from the Global Alliance to Eliminate Lead Paint. For example, they've created a model law with a recommended lead limit. They have testing guidance and enforcement guidance, and there are examples out there. And this makes it so much easier for governments to know what is best practice, and also makes the process of introducing and enforcing regulation significantly easier. Another factor that helps is the international precedent and momentum. A number of low and middle income countries have recently introduced regulation, and this kind of gives a sense of not wanting to be left behind, and it also shows that it can be done. And then another factor is that regulation has national scale impact. So it only takes working with one regulatory authority to impact lead pollution at a national scale. Working on prevention at the policy level is just such a highly leveraged way to have a large scale impact. And this is also one of the factors that makes this work so cost effective. An external evaluator estimated that it costs $1 to prevent a child lead poisoning through LEAPS programs. So I think the takeaway is that ending the availability of lead paint is a real low-hanging fruit. But despite this, there's still a very long way to go. Lead paint is receiving very little attention and resource at the moment. We know it's doable. We just need to build on this momentum and make it happen. And obviously, the sooner the better.
Thank you. So, I mean, it's incredibly inspiring what the people on this stage are doing. It's incredibly heartening to see the progress so far, even against this background of kind of horrifying news that we've shared earlier today. And, you know, again, to give a sense of perspective, you know, we had the graphic earlier today of the 3-gallon jug of water in the 660,000-gallon Olympic-sized swimming pool. I want to give you another visual. Like, look around. Pretty much everyone working on this issue is in this room. That's a little bit of an overstatement, but not that much of an overstatement. It's probably like genuinely probably about 2/3 of the entire community. That means that any individual person who decides to take this on to work in this area has just like such a tremendous amount of potential to make an impact. There's so much work to be done. There is so much that's doable, and you know, we're hoping to grow this community, but it's not a big one so far, and it needs to be a lot bigger to take on this problem. So I hope that's sort of an exciting call to action for the people in this room. Like, let's do it. It's very possible. Let's open it up for maybe 10 minutes or so of questions and comments from the audience. Yes, and please wait for the mic to come to you before speaking. Oh, right there.
Hi, Desiree, UNICEF, working currently with ABIT. So thank you so much. I'm so pleased to see the several efforts happening when it comes to addressing the sources. I mean, I know the CGD, I'm so impressed by your passion ratio on lead, which is everyone else's passion in this room. So I think when it comes to the addressing the sources, it's good at national level, and I could not agree more. When it comes to legislation, it's imperative to have you know, proper legislation at country level, and of course that needs to be complied and enforced. But hearing the earlier session, which is on the primary mining of lead, why is it continuously being mined when in fact you can have the secondary source? So, so all of this, you know, why is still there? If lead is a very recyclable heavy metal, then why is there a lot of primary source, which is mining, right? So there's something wrong. So there's a global environmental governance issue, which I would encourage. I mean, having come from UNEP myself, maybe at the International Conference on Chemicals Management, if there's an opportunity to have a CGD-led or any of our partners here to speak about and present lead as an issue beyond paint, I think we can really do something at the global environmental level. So the ICCM5 is a good opportunity for this group to present lead as an issue, really impacting our children's brain and development.
Yeah, thank you so much. I mean, I think that's exactly right. I mean, part of the problematic nature of this challenge is there is recycling of lead, but actually demand is growing. And Rita's presentation on the electric tuk-tuks is so compelling because you saw those 5 giant batteries, and demand is growing. That's 5 times the size of batteries that would be in a typical old school car. The demand for traditional automobiles is continuing to grow. So right now, lead is still serving a useful purpose that we don't have a ready substitute for, where demand is growing. But we need to figure out how to do that safely, how to do that without these horrible environmental emissions, occupational exposures, and the sort of follow-on contamination of the environments for decades and centuries to come. But I think raising it with the SICOM, the International Chemicals Conference, is a good idea. That's definitely on our radar. I think from my perspective, I've been sort of thinking about this from the policy perspective, not the intervention space. We're trying to attack it from all sides, right? I mean, sort of throw some spaghetti at the wall and see what sticks, see where we can get traction, see who's interested, see where we can get momentum, and try to keep building on that. It's a small community of people, but it's getting bigger. And I think we're trying to expand the pathways where that can happen, and aim high, right? Aim to really transform this to end childhood lead poisoning by 2040, not just to take a small bite out of the problem. Every bite helps. I'm not disparaging the bites. The bites are great. But let's also aim high. Let's also keep in sight that there is a big picture goal, that it is worth achieving, that it is doable, and we should be aiming there, not just the bites. Garrett.
And the reason that we're continuing to mine more lead is that we have more cars. It just tracks the increase in the number of cars on the road. That's all it is.
Lucia.
Yeah, and another thought, I mean, even if not going so far as back to the primary source, the source of lead in both the paint that we're working on and the spices that you're working on is lead chromates. It's the same pigment. And maybe there's something we can do to control that. There's no real need to have lead chromate in the world. So that's like another level potentially for intervention.
So we're in our working group, we're still in kind of the deliberation phase, so we're not ready to say anything. But one thing that keeps coming up is, should we say something provocative about basically having as a general posture banning non-industrially essential uses of lead? And there are some political problems with that. There are some uses of lead that are politically sensitive, like ammunition, for example. You can see that being a problem in the United States. But is that the sort of kind of big picture statement of where we should be going? I mean, even for ammunition, there are perfectly adequate substitutes, right? It's not that it has to be lead. It doesn't have to be an attack on guns or guns' rights. It can be just a substitute to an equally effective alternative material. So that's one thing we're mulling over. But I think we're trying to figure out, what's that right entry point of ambitious enough to really get us where we need to go, but not triggering a backlash, not triggering a political opposition that doesn't need to be there.
May I just say one thing on that note? That was a great point, that those are all the various directions we need to look at. Something else, parallel funding required for R&D, right? Mm-hmm. So if this is the demand, we need to eliminate that demand. How does one do that? So there's work there to be done as well.
Definitely. Carol.
So clearly, we see the power of the data, New York City's data set, and it seems that there's probably other cities around the world that are collecting data around contaminated products, and you've alluded to having a repository. What does that look like? What are we talking about there?
Thank you. So what that would look like, if we were to think, let's say, USA alone, right? We have a system in place for childhood blood lead monitoring in the country. Ideal picture, all of the jurisdictions that are doing this evaluations of every elevated child, they incorporate within this follow-up investigation this aspect of, is there consumer product associated risk factor? That is informed by lessons learned from everywhere, right? Targeted. At the interim, perhaps pick some big cities. And not just in the United States, but the United States already has this system. So pick some big cities where there is demographic variability. Because what is the goal? The goal is to try to identify risk factors, signals, right? Basically, figure out those signal places so that the broader efforts can be made into these countries of origin with everything that we've talked about. There are so many strategies different folks are using, and I know we'll be discussing with EPA as well, how can we kind of coalesce and not reinvent the wheel, but that's kind of was the repository would be not just collecting data here and there, systematically tracking it, and tracking some key variables is very important. Purchase country, for example, made in country if possible, making it transparent. Because we have it on open data. It's the first thing that we did, and NGOs and others are using it to trigger, inform, supplement, however, right? Making that transparent, that's how we cross boundaries. So, yeah.
Hi. This is a bit of a follow-up question to the blood lead tracking in New York City, and if you have a positive case in a child, that the family might get investigated as well to see if anyone else has been affected. Are there pathways in place where an adult might be the first one triggered? Because I come from an occupational health perspective, and the people working with products of that nature, but then do their family members get that treatment as well?
Absolutely. One of the teams I head is the adult lead poisoning prevention program, besides the other team, which is all consumer products related. One thing that I've tried to do in the city is connect. Consumer products can impact all ages. It's all in the use, right? I mentioned about the ceramic ware before. Just to get back to your point, so federally, if workers are working with or around lead, a proper employer is supposed to monitor, right? A blood lead monitoring is in place if the workplace exposes them to X amount of lead in the air. We get the blood lead report. So anyone occupationally getting this blood lead monitoring, we get the report, there are protocols to follow up, but what we've tried to do is even with the adult follow-ups, both pregnant and non-pregnant, and of course the children as well, build in this consumer product aspect. The questionnaires are expanded for all of these investigations because it is not just about the occupation for the adults. It is not just about pain for the kids. It's cross. Products really cross those age gap, right? So exposure science is like, then what is the exposure? How does it get? So yeah, I can talk and maybe we'll continue talking because it's interesting.
Out in the back of the room.
My question concerns spices. I was just curious that you pointed out that Bangladesh, Nepal, and Pakistan had among the highest levels. What about India? Are they doing something different?
India was also one of the countries in the publication. That one was more of an infographic of our top 5, but India was amongst there as well, among other countries as well. So again, signals, and you're doing.
We're finding high levels of lead in spices through the whole northern area of India. Less so in the south, but we've tested many different spices, hundreds of different spices in the north, and had very high results.
Okay, well, thank you all. I think we're about ready to wrap up, but before we do, we have one last thing to show you. So we've been talking today a lot about really big numbers, really big, horrifying numbers about the scale of this problem. But Pure Earth has recently put out a short documentary film about one family who's impacted. And it's worth remembering that behind every big number are a lot of individual families and people who are affected, who are struggling, who are trying to do the best they can in a really tough situation. So let's watch this. It's about 5 minutes long, and then we'll conclude. Thanks.
তোমার স্কুল তো ক্লাস শুরু হইব 12টার সময় শুরু হয়ে গেছে গা এখন কয়টা বাজে ঘড়ি দেখছো না সময় দেখুন নাকি না কয়টা বাজে স্কুল যান লাগবো আমার নাম শাইলা আক্তার আমার দুই ছেলে বড় ছেলে ক্লাস 3-তে লেখাপড়া করে আরেকটা ছেলে আছে সাথেই আমার ছোট আর আমরা মির্জাপুরে আছি এই জায়গায় অনেক বছর ধরে শিহাব যখন আমার গর্ভে ছিল আমাদের বাড়ির পাশে একটা ব্যাটারির কারখানা ছিল ওইটা দিনে বেলা ভাঙতো রাত্রে বেলা পুড়তো রাত্রে বেলা যখন পুড়তো তখনও দুর্গন্ধ দিনে যখন ভাঙতো তখনও দুর্গন্ধ ছিল ওটি নিঃশ্বাস নিতে খুব কষ্ট হতো শাকসবজি কোনো কিছু আমাদের এই জায়গার আশেপাশে তা খাইতে পারতাম না ওইটি একবারে কালা হয়ে থাকতো সবাই বললো যে সমস্যা হয়ে যাবো গা সবাই ভয় দেখাইতো তখন যে দুজনেরই সমস্যা হইব বাচ্চারও সমস্যা হইব মায়েরও সমস্যা হইব সবাই আরো টেনশন করতাম কিসের নিকে আমার বড় আরেকটা ছেলে আছে যদি আমার কোনো কিছু হয়ে যায় তাহলে ওর কি হইব ফ্যাক্টরি আসার আগে এটা ও লেখাপড়া করতে পারতো সাইম ও মনে রাখতে পারতো তারপর পরীক্ষা দিয়ে ক্লাস 1-এ উঠলো 1-এ উঠেও ভালোই রইলো তারপর আস্তে আস্তে সব কিছু গুলিয়ে ফেলাইলো এইটাই আমি বুঝতেছি এখন যে এই শিশার কারণেই মনে হয়
তুমি কোন ক্লাসে পড়ো
তো
ক্লাস 2-তে কোন স্কুলে
রাজাবাড়ি
আর স্কুলে তোমার বন্ধু বান্ধব কারা
মিম আর অনেকে আছে
ও মিম তোমার স্কুলেই পড়ে
হ্যাঁ
তোমার
আমার
ক্লাসে?
লাগে হ্যাঁ
কোন ক্লাসে
3
ও মিম 3-তে পড়ে
ও তো উঠতে পারে আমি উঠতে পারি
তুমিও 3-তে পড়ো
হ্যাঁ
তুমি একটু আগে বললে তুমি ক্লাস 2-তে পড়ো
মনে নেই
মনে নাই
মাছ নেবে না
মাছ দিছ খাইলে কি করবো কৌশা হল হ্যাঁ
ঘুমাইবে
ঘুমাইবে না পুরো হবে
এখন দিন যত যাইতেছে কোনো কিছুই মনে রাখতে পার না এই যে ওনার থেকে ছোট ছোট পোলাহানি হাসি ঠাট্টা করে সারাক্ষণ এটি শুনে ওরা বউ লজ্জা পায় যে পড়তে পারে না মানুষে ই করে এই যে টিচারের কাছে একটা পড়তে দিছে ওর একটা ম্যাডামের কাছে তাও কোনো কাজ হইতেছে না স্কুলে পড়ে কোনো কিছুই মনে রাখতে পারে না মাসে শেষে টাকা দেন লাগে পড়া না দিলে আমি টাকা দিম কি সেজন্য ওরা বলে এটি নিয়ে অনেক টেনশনের মধ্যে আছি ওরে নিয়ে এই শিশার কারণে আমার 2 ছেলে রক্ত পরীক্ষা করছিল সাইমা শিহাবে রক্ত পরীক্ষা করার পরে এই রিপোর্ট দিছে আমার 2 ছেলের সাইম ও শিহাবের শরীরে শিশা ধরা পড়ছে শিহাবের ধরা পড়ছে 471.28 আর সাইমের ধরা পড়ছে 291.14 ওর চিকিৎসার বিষয়ে এটি আমি কোনো কিছুই এখনো জানি না যে কিভাবে এটি এই শিশা থেকে মুক্ত হবে এবং লেখাপড়ার প্রতি ওর মন আসবো এটি আমি এখনো সঠিক জানি না কোনো কিছুই এটি জানার জন্য আমার খুবই ইচ্ছে যে ওরে কি করলে ও আগের মতো স্বাভাবিক হয়ে যাবে ওরা পরে কথা 30 দিনে তো 30টা করে যদি অক্ষর একটা করেও যদি শিখে তাও তো হইব কিন্তু কোনো
বলো এ উচ্চারণ এ উচ্চারণ এ উচ্চারণ এ উচ্চারণ এ
আমার আশা খালি 2 ছেলে লেখাপড়া করলে মানুষের মতো মানুষ হইলে আর আমার কোনো আশা নেই
উচ্চারণ এ
Thank you, everyone. That is a tough watch, but an important one. Thank you for putting it together. And I don't want to end on too much of a sad note, because I think the upside, the plus side, is that we've talked about what we can do and we can do. And we can do it starting today. We can do it with everyone in this room. We can talk to people we know and try and expand the community. I'm so excited to see new connections being formed, even just over these discussions during the breaks. I hope we can keep that going. Let's move this forward. And thank you so much to all our panelists, to everyone for attending. And please enjoy a reception in the back area after this. Thank you so much.